What's going on? What the hell? What is going on right here? What's up, world? How we doing? How we doing? How we doing? Y'all already know what we are doing today. We are doing NCLEX questions today here on this Wednesday. Hopefully everybody had a really good week so far. I got questions for y'all today because, I was a little bit more proactive. But of course, y'all already know what I want. I need at least 100 people up in here, and I need at least 1,000 likes. If we don't get either one of those, as a matter of fact, if we don't get both of those, we ain't going nowhere. I don't know what you want from me. But of course, if you guys are new here, my name is Kevin. I've been a nurse for 4 years, a registered nurse. I've worked ICU, OR, and PACU. I was in the Navy for 16 years as well. But of course, I want to know about you. I want to know who you are, where you're from, and where you are at in your nursing journey. Also, make sure you share this live. Make sure you like it. Make sure you follow me. You turn those notifications on, because that is the trifecta that TikTok needs for as long as it's alive or go somewhere else. But that's what it needs to get people here. What's up, Queen? How are you? Hey, did anybody pass their NCLEX? Hey, if you pass your NCLEX, drop it down in the comments so that way we can give y'all's flowers, give you all your love, because that's what we do around here. We do nothing but spread positivity. All right. Hey, I'm at 76 likes or 76 followers and 600 likes. What are we doing? Samantha. Sup, yo? How are you? Samantha, my frequent follower. So I appreciate you being here. Hey, by the way, I got something for y'all. Hey, got it up. It's ready to go. Hey, we're going to be doing a live NCLEX review. 3 days. We're going to be doing a live NCLEX review from April 12th to April 14th. April 12th to April 14th. And we're going to be talking about it, but here we go. That way y'all ain't got to look at me like that. You know what I'm saying? Who said something about my haircut? Haircuts are on point. Hey, that's what I'm saying, right? And sometimes I feel better. You know what I'm saying? Y'all already seen those TikToks where dude gets haircuts and they don't know how to act. That's kind of me right now. All right. But here we go, ladies and gentlemen. Welcome. You guys see I got a new thing right here. Make sure you guys like, share, and follow. But here we go. Question number 1. Nurse Channing is caring for 4 clients and is preparing to do his initial rounds. Which client should the nurse assess first? So this sounds like a management of care type of question. All right. Who do I see first? Who's going to die if I don't see them first? This may look familiar, right? This may look familiar, but that's okay. It's all about understanding what these questions are. So is it A client with diabetes was discharged today, a 35-year-old with tracheostomy and copious secretions, a teenager scheduled for physical therapy this morning, or is it a 78-year-old with a pressure ulcer that needs a dressing change? What are we thinking? Shout out to everybody that's just now joining. We are doing NCLEX questions. Hey, we're on the road to 10,000 likes. If I don't have 10,000 likes by the time I get to question 10, my throat hurts. And I'm going to get laryngitis along with bronchitis and everything else. All right. All right. If you guys are just now joining, I got these questions off of nurseslabs.com. They are free sets of questions. You guys can go over there and check those out for yourself. It is nurseslabs.com. But here's our answer in 3, 2, and the answer is B. It is a 35-year-old male with a tracheostomy and copious secretions. The patient with an airway problem should be given the highest priority. The ABCs identify the airway breathing, and cardiovascular status of the patient at the highest of all priorities in that sequential order. All right. These are all management of care questions, by the way. Management of care is the largest section on the NCLEX at 15 to 21%, 18 to 23%. Doesn't matter about the numbers. You just know that it is the largest section. And if you're an LPN, I haven't caught one of these in forever. Gabrielle, I'm glad that you're here though. Hey, and by the way, if you're an LPN taking your NCLEX, just know it's under coordinated care. All right, coordinated care, which is the largest section for the NCLEX PN exam. All right, here we go. Question number 2. Nurse Janice enters a room and finds a client lying on the floor. Which of the following actions should the nurse perform first? So you walk in on a room and somebody's on the floor, face down, something else up. Let me stop. Here are our answer choices. Do I call for help to get the client back in bed, establish whether the client is responsive, assist the client back to bed, or ask the client what happened? What are we thinking? Shout out to everybody. Hey, if you're getting ready to take your NCLEX, hey, you guys are some smart and intelligent individuals. You guys have put in the work to get here. You have put in the work to get here. We do not quit. Hey, don't come to me and ever tell me, Kevin, I'm going to quit. You might as well just not even tell me that, because if you tell me that you're going to quit, I'm going to do my hardest to convince you that you're not going to quit. All right. I don't do quitters over here on my live. I don't do quitters in my inbox. I don't do quitters when you email me. Don't come to me with that, because I'm going to check you and be like, oh, so we just quit? Hope you don't quit on your patient like that as much as you quit on yourself. Hopefully not. But we want you to be smart and intelligent individuals, and everybody can accomplish this goal. All right, here we go. But the answer is B, establish whether the client is responsive. All right, assess the client's level of consciousness first to determine whether the patient has had a loss of consciousness, then do the remaining choices if possible. The initial first step is to evaluate for reactivity using objective measures. Address the patient verbally. Hey, Mr. Samantha, can you hear me? Can you hear me, sir or ma'am, or whatever you identify as? I'm just saying. All right. So make sure that we get verbal, right? To light shaking. Also think about the sternal rub if they're unconscious, or, messing around with their nail beds with a pen, whatever type of stimuli you can get. Then progress to more intense mechanical situations. All right. Management of care. All right. Me, Samantha. All right. I need to be checked daily. Bella, I'll check you daily. You know what's up. If y'all are new here, y'all know I will check you daily, all right? But I do it in the most loving and respectful way possible. Unless you want me to be disrespectful to you, then we're going to have another conversation, all right? But anyways, question number 3. Paige is a nurse preceptor who is working with a new nurse, Joyce. She notes that Joyce is reluctant to delegate tasks to the members of the care team. Paige recognizes that this reluctance is due to what? What is it due to? All right, is it role modeling behaviors of the preceptor, the philosophy of the new nurses school of nursing, the orientation provided to the new nurse, or the lack of trust in the members of the healthcare team? You miss me? I miss you too. I miss you too, Lala. But we out here, you know what I'm saying? We out here doing our thing. Gladys is telling me B. Hey, if you guys are new here, welcome. We're on the road to 10,000 likes. If I don't have 10,000 likes by the time I get to question 10, my throat hurts. All right, so get carpal tunnel for me right now. I just got a 99 on my farm. That's what I'm talking about, Rena. That's what I'm talking about. Congratulations to you. Pharmacology is a monster. It is a monster of a section in school and for NCLEX. So, hey, shout out to you. Don't you ever forget it either. All right. All right. Let's see. Let us see what the answer is. Why somebody on spam calling me? What's wrong with them? They know better. Here we go. Here we go. And the answer is D. It is the lack of trust in the members of the healthcare team. Now, lack of trust is the common reason for reluctance in a delegation of tasks. Some managers don't delegate because they feel they can work better than others. Since ultimate responsibility is on the delegator, aka the RN, because the RN is the one that delegates, right? They prefer doing the work themselves rather than getting it done through others. But the point of being a leader is to delegate those tasks. Not saying that you're not capable of doing them, but other people are responsible for doing those tasks, although you are ultimately responsible for what's going to happen. So can an RN do activities of daily living? Absolutely. But do they need to be tasked to do that when they could be doing things of other importance? Yes, absolutely. That's the whole point of delegating assignment, tasks, and so on and so forth. All right. So if you didn't get this one right, circle back and understand what this question is asking. All right. Nurseslab.com, free sets of questions. You guys can go over there and check them out for yourself. Real quick. Hey, I'm going to be doing a 3-day live NCLEX review, April 12th to April 14th. All right, which is not obviously this Friday, but the next Friday, Saturday, and Sunday. And you guys can check that out at thebootnurse.com/3-day review. All right, here we go. Question number 4. Nurse Paul is developing a care plan for a client after bariatric surgery for morbid obesity. So Nurse Paul was messing around with somebody who was big. All right, you know what I'm saying? So the nurse should include which of the following on the care plan as a priority complication to prevent. So what do we want to prevent for somebody who had bariatric surgery? Do we want to prevent pain, wound infection, depression, or thrombophlebitis? What are we thinking? Will you do content covering, Kevin? Of course we'll be covering content. We're going to be going over the 8 sections of the client needs categories. We're going to break questions down. We're going to talk about those important things that you need to know, those trigger words, all the things I talk about when I do live on here. Hey, who said who did really good at farm? Hey, if you need doses calculation in your life, Nurse C, I call her Nurse CC. All right. She's the doses calculations queen. She just jumped up in here. I'm going to pin her. She's probably going to be like, oh my God, Kevin, why? Girl, you know what's up. Hey, this lady right here is the doses calculations queen. If you need to get your doses calculations, you need to go and check Miss Lady out. Will the 3-day class be free? No, it will not be free. It's $197. All right. But the answer is wound infection. All right. Wound infection is the most common complication among obese clients who have undergone surgery. This is due to the poor blood supply in their adipose tissue. All right. From a surgical standpoint, obesity is associated with a multitude of complications, including impairment of cutaneous wound healing, total wound failure, and fascial dehiscence. All right. Management of care. All right. Management of care types of question. I'm telling you right now, if y'all are trying to get your dosage calculation right, I'm telling you, Nurse C will get you right. She does live all the time. I don't know her schedule. Just go follow her, turn your notifications on, stop playing games. All right. And she going to get you right. She does tutoring as well. Just letting y'all know. So for y'all having difficulty, Miss Lady will get you. All right. Here we go. Question number 5. A client presents to the emergency room with dyspnea, chest pain, and syncope. All right, the nurse assesses the client and notes the following assessment cues. They're pale, diaphoretic, has a blood pressure of 90/60 with respirations of 33. The client is also anxious and fearing death. Which action should the nurse take first? Should they give pain meds, IV fluids, dopamine, or oxygen via nasal cannula? What are we thinking? Now think about it. There's no assessment that needs to be done in our answer choices because we have all the information that we need. Kate, what's up? Anybody that wants to go paramedic route, if you happen to be in here, the Medicaid will get you right too. Y'all go holla at Miss Lady. She's going to be a PA soon, but you know what the deal is, right? Somebody said ABCs. Okay. Thinking about ABCs, right? So think about that. All of your assessment is given to you in your question. So we don't need to assess anything. We now need to implement something. All right. So everybody's telling me B. Everybody's telling me B. We're talking about the blood pressure. Okay. Now, that's important. Very much so, right? But let's think about that. What is the very first thing that we're going to do? Somebody says D, airway. Okay. Shout out to y'all. Hey, if you guys are new here, welcome. We're doing NCLEX questions. I got them off of nurseslabs.com. You guys go over there and check them out for yourself. But let us see what the answer is in 3, 2, and the answer indeed is D. It is administer oxygen via nasal cannula. The promotion of adequate oxygenation is the most vital to life and therefore should be given the highest priority by the nurse. When the nurse needs to prioritize patients, Maslow's hierarchy of needs theory is used to decide which patient is to be seen first. As part of Maslow's hierarchy of needs is airway, breathing, and circulation, which are physiological elements that are needed for the body to survive and help determine one's level of health. Hey, the airway, they already had difficulty breathing. They had difficulty breathing, right? It said it. They have difficulty breathing. Although the blood pressure was low, what is the very first thing that we're going to do? We're going to give them oxygen first. All right. And remember, this is why I always say we need to read. We RTFQ, we RTFA, and we RTFR. Who can tell me in the chat, my frequent flyers, what that means? Let them know because people are about to ask me. All right. Let them know what RTFQ means. Let them know what RTFA and RTFR means. All right. So it says never read into the question. Exactly. Don't read too much into the question and don't create anything else that needs to be there. All right. Because once you start doing the what ifs, you're going to get the question wrong. All right. Shout out to everybody who's following. I wish I could keep up, but there's a bunch of y'all that are jumping on here. RTFQ, Gabrielle, let them know what's up. All right. But the answer is D, it's oxygen. All right. So make sure you circle back, read the F in question. You know what's up. Hey, ladies and gentlemen, if you guys are new here, hey, I got some testing tips to help you conquer the NCLEX. That's a free download. 42 pages of just delicious, buttery goodness with that melanated dude right there, minus his fanny pack. Mostly it's because the fanny pack is awesome. If you don't got a fanny pack, what are you doing with your life? I don't care what you say. Get you a fanny pack. All right. But check that out at thebootnurse.com/test. Free download. It's going to get sent to your email. Hey, once you get it, it's yours. Have at it. It works. It helps. Check it out. bootnurse.com/test. And it's also linked in my bio. It says Chocolate Man with NCLEX tips. Danny, stop it. What are we talking about? This is, hey, we're family friendly around here. Question 6. All right. Question 6. Nurse Pietro receives an 11-month-old child with a fracture to the left femur on the pediatric unit. Which action is important for the nurse to take first? What is the very first thing that I do? So do I call for a social worker to meet with the family? Do I check the child's pulse, blood pressure, respiration, and temperature, administer pain medications, or speak to the patient or the parents of how the fracture occurred? What are we thinking? Hey, if you guys are just now joining us, my name is Kevin. I am a registered nurse. I've been one almost 4 years. I've worked ICU, OR, and PACU. I also was in the Navy for 16 years. I just recently got out in January. So, I appreciate everybody being here trying to get their learn on. It says call the social worker. They do. Stop it. I mean, if you're right, you're right. If you're wrong, you're wrong. All right. But shout out to everybody that is here. Dropped out of pre-med 9 years ago. Just started to try, get my nursing degree. give us some Hesse. Well, I don't do Hesse. We don't do Hesse. Hey, if you want Hesse, you can go check out my girl, the nurse Sam. She does Hesse every Tuesday. So you can go check that out. All right, let's see what the answer is in 3, 2. And the answer is D. Speak to the parents about how the fracture occurred. How the fracture occurred. Why? Because how old is this child? I do not do ATI. I do not. How old is this child? Why does an 11-month-old have a fracture? Think about that. Anyway, so in case of injury, especially among children, it is very important that the nurse should assess for possible abuse. Abuse is one of the reporting responsibilities of the nurse. The first step in any child protection response system is to identify and or possible incidents of child maltreatment. All right. Understand that. You have to understand. Look at your child. That child is 11 months old. Why? Why do they have a fracture? You see what I'm saying? So those are the things you have to think about. We're talking about child abuse. Who do we report in regards to child abuse? Like our babies and our elderly and people that cannot defend themselves. So you have people that have mental instability as well. All right. So think about that. Pulling on the child. Look, you creating a fracture in a baby. It's doing a lot more than pulling. I can tell you that. All right. So here we go. It says, this is giving me encouragement. I failed my NCLEX 3 times and took a year off, but I'm back on it. Brandy, that's what I'm talking about. Do I tutor? Yes, Cameron, I do tutor. You can check that out. It's on my link. It's in my link tree. It's NCLEX coaching and mentoring on my main page. All right. Here we go. Question number 7. Nurse Sky is assigned to the cardiac unit, caring for 4 clients. I can only guess what type of question this is. He is preparing to do initial rounds. Right? Initial rounds. Which client should the nurse assess first? Who's going to die if I don't see them first? All right. Who requires my attention right here, right now? Is it a client for cardiac ultrasound this morning? A client with syncope being discharged today? A client with chronic bronchitis on nasal oxygen? Or is it a client with diabetic foot ulcers that needs a dressing change? What are we thinking? What are we thinking? What are we thinking? By the way, I want to know who you are. I want to know who you are, where you're from, and where you are at on your nursing journey. Y'all know all about me, but I want to know about y'all. Make sure you guys like the live, you guys share, you guys follow. That is the trifecta that gets to the For You page. Y'all found me on the For You page. So what are we doing? What are we doing? It says, how long do you study if you got to take the NCLEX again? Jazzy, that all just depends. Some people need 30 days. Some people can take up to 90 days. In reality, if you're studying longer than 90 days, what are you really doing? What are you really doing? But in reality, you can study for up to 30. You can study 30 days and be ready for the exam. I coach people often and it's on 30-day increments and they pass. All right. But the answer is C, a client with chronic bronchitis on nasal oxygen. A client with airway problems should be attended to first. Right. And it's going to go back into the Maslow's hierarchy of needs where we talk about ABCs in that specific order. That's what we want to check for. Now, here's something I want everyone else to realize is that level of consciousness also goes with ABCs. How long would you study every day? So it all just depends. It all just depends on what you need. Some people study every day. They study every other day. With coaching, it all just depends. For you, I don't know. I don't know exactly what your study habits are. All right. So remember, airway, breathing, circulation. Also think about level of consciousness. That's very, very important. Your level of consciousness tells you that you have an airway, breathing, and circulation problem. Chronic threw me on that. Yeah, threw you on that one. That's why you got an RTFQ. You got to read the questions. Thinking of becoming an RN. Do it, Tiffany. Become an RN. Hey, there's so many different ways that you can move out here by being an RN. And just because you're an RN or an LPN does not mean that you have to work bedside. How do you feel about taking the NCLEX immediately? Do it. If you're coming right out of school, take the NCLEX as fast as possible because you have all the information that you learned in school in order for you to take it. Now, the longer you wait, the more data you start to lose. You start to lose all that information that you gather while you were in school. All right. But here we go. Question number 8. The nurse enters a room and finds a patient lying face down on the floor and bleeding from a gash in the head. Right. Which action should the nurse perform first? What's the very first thing that I want to do when I walk in on somebody who's face down and swimming in their own blood? Right. What are we thinking? All right. Is it A, determine the level of consciousness? B, push the call button for help, turn the patient face up to assess, or go in the hall to get the nursing assistant to stay with the client while the nurse calls the physician? If any of you pick D, I'm going to ban you right now. Oh, hey, sometimes it's just that easy. Sometimes it's just that easy. If you guys are wondering where I got these questions from, I got them off nurseslabs.com. They are free sets of questions, free sets of questions. You guys can go over there and check them out for yourself. If you're in nursing school right now and you have not shared this to people that are in your cohort, you're wrong, and I need for you to fix yourself. All right? Don't be stingy. All right? I don't care if you don't like Becky with the good hair. I might. Okay? I might. She might be cool with me. You see what I'm saying? So, like, bring her over here. Y'all are all in cahoots together. Stop playing games. All right, let's see what the answer is. It says nurses' labs are the best. Do them. They're pretty good. They're pretty good for nursing school for sure. Not Becky. Look. C, you know what the deal is, okay? Here we go. And the answer is A. It's to determine the level of consciousness. Assessing the level of consciousness should be first action when dealing with a client who might have fallen over. The initial step is to evaluate for reactivity using objective measures. Address the patient verbally. Progress to light shaking and then progress to more intense mechanical stimulation. So as a CNA, if y'all call me, I'm quitting right after. Hey, don't quit after we save the patient. Quit after your shift because I don't want to get you. I don't want them getting you for patient abandonment. What's up, Katie? How are you? Hope you're doing well. As well, you know we're doing NCLEX questions. That's how we do. All right. So, ladies and gentlemen, like I said, level of consciousness is important, right? Hey, check them out. Hey, can you hear me, Mr. So-and-so, Mr. Jones, Mr. Jones? Can you hear me? You know what I'm saying? That's what we want to do. All right. Here we go. Question number 9. Nurse Kevin. That's me. You know what I'm saying? That's me. Or whoever else is named Kevin, whatever, is working on the night shift with a nursing assistant. All right. The nursing assistant comes to the nurse stating that the other nurse working on the unit is not assessing a client with abdominal pain despite multiple requests. Which of the following actions by the nurse, that's me, is best? Do I ask the other nurse if she needs help? Do I assess the client and let the other nurse know what should be done? Should I ask the client if he is satisfied with his care, or should I contact the nursing supervisor to address the situation? What are we thinking? What are we thinking? Got some people saying A. We got some D's over there. All right, throw some D's on it. So shout out to y'all. Hey, so if you guys are new here, here's one other thing that y'all don't know about me. If you're new here, I failed my NCLEX 3 times. Cue the silence. Not once, not twice, 3 times. Shocking, right? So, I failed it 3 times. And let me tell you something right now. Nobody cares. Nobody cares how many times you failed it. Hey, listen to me. Your patient's not going to care. Your job's not going to care. Sally Sue, who went to school with you, don't care. We are our own reasons for not being successful because we give a shit about what other people think. Stop thinking about what everybody's thinking. Stop thinking about it. Get out of your own way. Get out of your own way and tackle that exam. All right. I failed it 3 times, y'all. And when I tell you, I told people at work, they were just like, "Are you serious?" I'm like, "Ain't that something, right?" But do you think I care? Absolutely not. We don't care because this exam does not determine what type of nurse that you're going to be. Only you will determine that. Only you. It says, Whipsy, I failed my NCLEX 3 times too. Sometimes I feel like giving up. Listen, let me tell you something right now. If I would have gave up, I wouldn't be here teaching y'all. Just letting y'all know. And this is exactly why I do it. It's because we don't give up. You want to know why? Would you ever give up on your patient? Nope, we wouldn't. Can I get a job right after I pass, or do I have to wait? You can actually get a job and work under a temporary license before you actually get your actual license. So there's that. But anyways, the answer is D. Contact the nursing supervisor to address the situation. The nurse should use the proper channel of communication. The nursing supervisor is responsible for the actions of the different members of the nursing team. Assessment and treatment of pain is often complex. The standard definition of pain is whatever the experiencing person says it is, because pain is subjective, right? Existing whenever the person or the experiencing person says it does. All right. So shout out to everybody that got that right. It says, baby, you are still young if you want to. Hey, let them know. Let them know, CC. Let them know. Hey, you're never too old to go to nursing school. I don't know where that thought process come from. I had people that were in their 50s and 60s becoming nurses. You want to know why? It's all about self-gratification. If that's what you want to do, then go do it. Who cares? Why does everybody worry about other people? Stop worrying about other people. Stop worrying about what somebody's saying. Tiffany says, I'm 40. It's never too late. Let them know, Tiff. Let them know. Can I call you Tiff? That's too bad. I called you Tiff anyway. Here we go. I'm 52. That's what I'm saying. 52 and beautiful. Yes, Lord. Here we go. Question number 10. Nurse Vivian is reviewing immunizations with a caregiver of a 72-year-old client with a history of cerebral vascular disease. All right. The caregiver learns which immunization is priority for this client. Think about it. What is a very prominent vaccine that I would give to an older patient is it Hep A, Lyme disease vaccine, Hep B, or pneumococcal vaccine. Pneumococcal. Hey, if you guys are just now joining, you guys heard my little spiel. I failed NCLEX, y'all. And let me tell you something. When I failed the third time, I promise you, I was just like, what am I doing wrong? Am I a failure? And then I had somebody pull me under their wing and pretty much was just like, hey, get out of your own way. You're not a failure. This test doesn't determine the type of nurse that you're going to be. And I'm a damn good nurse. My patients never asked me. Nobody at work ever asked me because it does not matter. Yari, ma'am, thank you for the rose. I appreciate you. It's not a normal test either. Nurse CC is right. It's not a normal test. How long did you have to wait to retake it? If you fail your NCLEX, you have to wait a 45-day waiting period in between each exam attempt, and each state has their own criteria. So, for example, the state of Florida, you can only take it 3 times. And if you fail it 3 times, you have to take a remedial course. The remedial course will then give you the green light or red light. They'll send it to the Board of Nursing, and then you can take it again. Now, in Texas, you have up to 4 years until you graduate, from 4 years from when you graduated before you can take it again. All right. You have 4 years from when you graduated to get your license. After 4 years, you have to appeal to the Board of Nursing. But the answer is D. It's a pneumococcal vaccine, and it is a priority immunization amongst the elderly, especially those with chronic illnesses. It is administered every 5 years. The pneumococcal vaccine is indicated in the United States for all adults 65 years or older, as well as younger patients with conditions that increase the risk of developing pneumococcal pneumonia or invasive pneumococcal disease. All right. What license is this for? The nursing license. So for registered nurses and licensed practical nurses, that's what it's for. How about New Jersey? I don't know. I don't live in New Jersey. So it's not just, I would just go to the New Jersey's Board of Nursing. You'd be able to see it. But ladies and gentlemen, speaking of me failing the NCLEX, I'm writing a book. I'm writing a book about how I conquered the NCLEX. You want to know why? It's because this test does not determine the type of nurse that you are going to be. It's not. You want to know, and I'm going to tell you right now, I conquered mine, and I want everyone to conquer theirs. All right. And you guys can pre-order right now. The only thing that you can pre-order right now is the Kindle version. Once the paperback version is up, you guys can switch your pre-orders over there. But check it out. thebootnurse.com/books. It's going to be sold on Amazon. Listen, I don't got no problem telling y'all about my failures. I gained nothing from lying to any of you. Nothing. All right. Because what kind of a person would I look like to tell you like some sunshine and rainbow trash that's out here? Oh, yeah, by the way, I'm an award-winning author. You see what I'm saying? Look at it. An award-winning author. Yes, ma'am. Let them know. Let them know. All right. So conquer it. The journey to passing the NCLEX. You know why? Because the journey to conquering the NCLEX begins with you. And it began with me, and it's going to start with you as well. So make sure you guys go check that out. All right. Check that out. thebootnurse.com/books. All right. Here we go. Question number 11, you are admitting a patient for whom is diagnosed with a pulmonary embolism, which must be ruled out. The patient's history and assessment reveals all of these findings. Which finding supports the diagnosis of pulmonary embolism? All right. So think about it. When the NCLEX wants you to use critical thinking in order to make a clinical judgment. How is your coaching experience? I have a 100% pass rate. I literally coached somebody for the month of February. For the month of February and March, she passed. She took her NCLEX on Friday, passed it on Monday. So I have a 100% pass rate, and I've coached over 100 people. So I've been coaching for 4 years. Just saying. All right. But the patient who was recently in a motor vehicle accident, the patient participated in an aerobic exercise program for 6 months. A patient gave birth to her youngest child 1 year ago, or a patient on bed rest for 6 hours after a diagnostic procedure. What are we thinking? The NCLEX wants you to use critical thinking in order for you to make a clinical judgment. All right. Think about it. What is a pulmonary embolism? Has anyone failed you coach? I've had 2 people that failed initially. I turned back around and I coached them, and then they passed on the second attempt. Now, once again, we're all about complete transparency. They failed because one was in a domestic violence type of situation, and the other one was homeless, living in the car with her son. And they did not tell me these things. And so, of course, life takes over. What am I supposed to do about that? Tell them not to be homeless and tell them not to be in a domestic violence situation? I care because I want them to be safe individuals. Once that we paused, we did whatever, they came back to me, we worked it out, they passed on their next attempt. And that's my guarantee to people. That's my guarantee to people that that I do coaching with. You know what I'm saying? Like, if you don't pass, I got you. You have me until you do, but you don't want me a second time. Trust and believe me. But the answer is A. The patient was recently in a motor vehicle accident. Think about this. Somebody who's in a motor vehicle accident, right? They're having trauma of some sort that's happening, right? Let them know, Grace. Grace, stop it. But let them know, right? The keyword recent was the keyword. There we go. Recently, right? Recent could be an hour. It could be what, in the last 3 or 4 hours, right? So keywords, right? So patients who have recently experienced trauma are at risk for deep vein thrombosis and a pulmonary embolism. PE remains relatively common after trauma and occurs in the absence of lower extremity or spinal cord fractures, or spinal fractures, sorry. Although PE is usually thought to occur between days 5 and 7 after injury, data suggests that as many as 37% of pulmonary emboli occur earlier. All right. That's why you see people that are on, the low molecular heparin. So like Lovenox, right? That's why they have those. Jason says, hi, Kevin. Just to let you know that 7-day NCLEX course is great. Help me pass my NCLEX. Jason Halstead. Jason is the first person today to come in here to tell me that he passes NCLEX. Well, at least the first person I saw. Jason, first of all, congratulations to you. Welcome to the greatest shit show on earth, known as it is being a nurse. Secondly, thank you for letting everybody know that the 7-day NCLEX course is great and that it worked for you. If there's a piece of advice that you could give to everyone here, what would it be? And of course, once again, congratulations to you. What time and day do you do these lives? I do them Monday, Wednesday, and Friday at 5:30 Central Standard Time. All right, here we go. Question number 12. You are assigned to provide nursing care for a patient receiving mechanical ventilation. Mechanical ventilation meaning they're going to be attached to the vent. All right, which action should you delegate to an experienced nursing assistant? Now, other words you'll see is a UAP. The nursing community is so supportive. Yes, we have to take care of one another. We have to take care of one another. No one else is going to who's going to teach us but us? I used to say that in the Navy. I was a surge tech in the Navy. Who's going to teach us but us? You see what I'm saying? Anyways, so here we go. Are we going to assess the patient's respiratory status every 4 hours? Are they going to take vital signs and pulse oximetry readings every 4 hours? Check the vent settings to make sure that they are as prescribed, or observing whether the patient's tube needs suctioning every 2 hours. What are we thinking? Nobody but us. Teach one. There we go. Each one, teach one. There we go. Love it. CC's out here letting them know. All right. Hey, if you guys are just now joining, hey, I'm doing a 3-day live NCLEX review, April 12th to April 14th. April 12th, we're going to start at noon and we're going to go till 5. And then on the 13th and the 14th, it's going to be an all-day event. Y'all gonna get tired of listening to me from 9 to 5, baby. And we're going to get this knowledge in. If you're interested in looking at that and being a part of that, hey, go check it out at thebootnurse.com/3-day review. You're going to get 3 days of review. You get the live, you get the recorded lives. You get access to the 30-day or to the 7-day NCLEX review. You get the community. You get my ebook. Hey, it's going to be a good time. It's going to be a great time. All right, but here we go. The answer is take vital signs and pulse oximetry readings every 4 hours. The nursing assistant's educational preparation includes measurement of vital signs, and an experienced nursing assistant would know how to check oxygen saturation by pulse oximetry. All right. So keyword is experience, but then you also have to realize there are those things that a UAP cannot do. UAP can't do suctioning. All right. UAP cannot interpret whatever readings are going on the mechanical or on the vent. That's not within their scope of practice. There you go, Tia. Not within their scope of practice. You are very, very much correct. So shout out to y'all if you got this question right. Remember, the key is to read the fucking question. Hey, if you don't like the F word, it's going to be a hard time you being a nurse, because nurses got potty mouths. It's 90% women. So you women got potty mouths. I'm just saying. I'm just an innocent child of God sitting in the corner listening to y'all. Y'all are terrible. But hey, if you didn't get this question right, circle back, okay? Make sure you guys get that knowledge. And oh my God, Jel, you already passed your NCLEX. What are you doing here? What are you doing here harassing me? All right. How often do you offer the 3? This is the very first live 3-day NCLEX review that I'm doing. All right. I have my 7-day NCLEX review, which is on demand, but this is the first time that I'm doing it live. And we're going to see how well it goes to determine how often I'm going to do it. I'm thinking about doing it once a month. All right. There's always room to learn. Yes, Jel, there's always room to learn. But here we go. Question 13. You are caring for a patient with emphysema and respiratory failure who is receiving mechanical ventilation through an endotracheal tube. To prevent ventilator-associated pneumonia, Which action is most important to include in the plan of care? You're welcome, Evelyn. Do I want to administer, order antibiotics as scheduled? Do I want to hyperventilate the patient before suctioning, maintain the head of the bed at 30 to 45 degree angle, or suction the airway when coarse crackles are audible? What are we thinking? Think about that. All right. There's things that you can do before you get orders that are standing orders that a nurse can do. All right. So what do we think it is? Hey, shout out to everybody just now joining. We are doing NCLEX questions. I got them off of nurseslabs.com. They are free sets of questions. Hey, I need for y'all to like. I need for y'all to share. And I need for y'all to follow. I need 20,000 likes. I need 20,000 likes, or all of a sudden I'm going to get ventilator-associated pneumonia and I'm not going to be able to talk without the ventilator. So I'm just going to get pneumonia. Hey, but I want to know who you are, where you're from, and where you're at in your nursing journey. And if you're not a nurse, what are you doing here hanging out with us? I saw somebody say that they were a lawyer. All right. So I know the law world can be pretty cruel. All right. But the answer is C. Maintain the head of the bed at 30 to 45 degree angle. Research indicate. Shout out to my respiratory therapist. Sorry, I got distracted. Hey, if y'all want to ever know anything about vent and airway management, you better find you a respiratory therapist and put your hand in their pocket. Malcolm X style. But no, I'm just playing. But hey, they will teach you everything that you need to know. I learned so much from my RTs when I was working in ICU. Hi, is it Gabby Gabasil? Hopefully I said that right, from Zimbabwe. Shout out to you. I'm a patient care tech. Shout out to you. Shout out to Texas. I live in San Antonio, so shout out to all my Texans out there. But research indicates that nursing actions such as maintaining the head of bed at 30 to 45 degrees decreases the incidence of VAP. These actions are part of the standard of care for patients who require mechanical ventilation. Proper positioning, such as keeping the head of the bed between 30 to 45 degrees and encouraging early mobility of mechanically ventilated patients, aids in the prevention of VAP. All right. So shout out to y'all. Keyword was prevent. You got to look for those trigger words. You got to look for those trigger words. LPN, soon to be RN. That's what I love to hear. Hey, listen, speak it into existence and it shall be so. Shout out to you, Christina. Shout out to you. I'm new here. Are you a nurse? Nope. I'm not a nurse. I'm just some random person that's out here talking about nursing stuff. Yes, user 53. I'm very much a nurse. I've been a nurse for 4 years, worked ICU, OR, and PACU. All right. So shout out to everybody that's out here that is participating. Hey, speak it into existence. Speak what you are going to be into existence, and it shall be so. And also, for all my people that are taking NCLEX, normalize passing at 150 questions. Also normalize that passing. I don't care if you got 85 questions. I don't care if you get 150 questions. A pass is a pass. A pass is a pass. All right. Here we go. Question number 14. You are evaluating and assessing a patient with a diagnosis of chronic emphysema. All right. Chronic emphysema. The patient is receiving oxygen at a flow of 5 liters via nasal cannula. Right. Which finding concerns you immediately? All right. Does the patient have bibasilar crackles? They have a respiratory rate of 8. They sit up and lean over the night table, or they have a large barrel chest. Now, let's think about this. All of these are some type of airway breathing situation, right? Which one is not normal that requires me to be like, hey, what are you doing? It says, let me correct that. I will be in LPN in July. That's Patrice. That's what I'm talking about. Others are expected. Look at you, Bean Machine. So scared to go to school for this. Why? What you scared of? If you're scared, go to church. Go pray. Hey, go pray to somebody, and then come back and then go to school. Because, hey, I'm telling you right now, no one ever did anything worth of anything in this world that wasn't scared. You're going to be scared, but you're going to do it anyway. You're going to do it anyway. Shout out to all y'all that are out here. I will be at LPN in June. I know that's right, Scorpio Q, because I'm scared to fail. Everyone says it's hard. Who cares? Sab, why do you care about? We don't care about what anybody has to say, because no one has ever walked. Is it Maya? Nobody ever walked a day in your shoes. Those people don't care about you. Sally Sue to your left and Becky with the good hair to the right don't give a shit about you. So why do you care about what they think? Yes, nursing school is hard. It's meant to keep people out. That's exactly why. So are you strong enough to be a part of this profession that is leading the way for the last 20 plus years? That's my question to you. I'm just saying. But the answer is that the patient respiratory rate is 8. Hey, what is our normal respiratory rate? It's 12 to 20. Anything under 12 is 8. That is part of like, hey, I need to get over there and I need to make some stuff happen. All right. I need to get over there and I need to make some stuff happen. That's what it is. All right. So for patients with chronic emphysema, the stimulus to breathe is a low serum oxygen level. All right. This patient's oxygen flow is too high and is causing a high serum oxygen level, which results in in a decreased respiratory arrest. Same thing with COPDers. Same thing with COPDers. Queen, thank you for the rose. I appreciate you. You have to dig deep, but it's worth it. I graduated 8 years ago. Listen, I graduated in 2018. And while I went through some tough times, I'm telling you right now, I love it here. And I especially love exactly where I'm at. There's so many things that you can do within nursing. It is unreal, but they don't tell you about that in nursing school because they want you to go work bedside. That's their whole point of being a nurse. You start out at bedside. You don't end in bedside. All right. All right. So shout out to you. All right, Maya, don't be scared. If you're scared, go to church. I want you to go to church and I want you to pray to God and let him know that you're scared. And then he's going to tell you, hey, with me, you can accomplish anything. And that's how we do it. All right. But here we go. Question 14. You are initiating a nursing care plan for a patient with pneumonia. Which intervention for cough enhancement should you delegate to the UAP, to the unlicensed assistive personnel, meaning the nursing assistant? All right. Took my NCLEX in 2020. Nurse years now. What are we talking about? I don't know what we're talking about. I'm also in LPN school. Shout out to you, Queen. All right. Is it A, teach the patient about the importance of adequate fluid intake and hydration? Assist the patient to a sitting position with neck flexed, shoulders relaxed, and knees flexed. Remind the patient to use an incidence spirometer every 1 to 2 hours while awake, or encouraging the patient to take a deep breath, hold it for 2 seconds, then cough 2 or 3 times in succession. What are we thinking? I will take my NCLEX. Is it Elisa? Is it Elisa? Did I say that right? Elisa Shem, shout out to you. Hey, you're going to rock that exam. You are a smart and intelligent individual. You put in the work and your work is going to come to fruition when you get your results. So, hey, you got this. Just like everybody else who's about to take their NCLEX, you got this. Remember, y'all, if you're new here, I failed my NCLEX 3 times, and I passed it on the 4th. Your test does not determine what type of nurse that you're going to be. It's not. Half this shit you're going to forget. But you need to know and understand and be familiar with all of this while you take an exam, this specific exam. All right. But the answer is C. Remind the patient to use an incidence spirometer every 1 to 2 hours while awake. Remind them. They can't. Hey, as RNs, for registered nurses, we do not delegate what you eat. Right. We don't delegate what we eat. They can reinforce what has already initially been taught by the registered nurse. That's the same thing for the LPN. Same thing for the LPN. Any tips on how to stay calm during the NCLEX? The best way to stay calm during the NCLEX is to prepare the same exact way of what the NCLEX looked like. So you're going to go into a testing center, recreate it. Put yourself in those situations early. That way, when you go and you take the actual exam, you would have already prepared for what it looks like. In the military, we call it, it's how it says, know thy enemy. Know thy enemy. Somebody said, can we see the question again? No, just like NCLEX, we don't go back. So we go forward. We always push forward. If you missed it, and that's okay. We go forward. On NCLEX, you can't go back. So I try to tend to keep it that way. All right. But shout out to y'all if we got it right. Hey, if you got it wrong, that's okay. Get the content. All right. Circle back, get your questions and answers, read your rationales. Your rationales allow for you to retain the information. Ladies and gentlemen, hey, I have an NCLEX course. And I have a community that you all can be a part of. And you can join it for $7. Yes, I said $7. I know some people are just like, $7? Are you serious? Yeah, $7. You can join it for $7. I have 2 reviews. 2 reviews in there to include a new generation NCLEX review where I go over 100 questions. I just uploaded 10 videos for the cardiac section. 10 videos. There's a total of 80 videos in there right now. So make sure you guys go over there and check that out. Hey, it's $7. Check it out at thebootnurse.com/special. Also, you can check that link out in my bio. It's in my link tree. Hey, but yes, it is very much $7. After $7, it goes to a subscription of $97 per month. I do live questions and answers just like I do here, but I go way more in depth. And also, I do lectures in there as well. So make sure you guys go over there and you guys check that out. It says, I only asked to go back because I wanted to make sure I read it correctly. No need for attitude. Oh, Kira, ma'am, ain't nobody got no attitude. Trust me, you would know if I had attitude. I don't got no attitude. I'm just keeping it real that we don't go back. So if you receive the message as if it was an attitude, that How you receive that has nothing to do with me. Just saying. Here we go. Question number 16. You are making a home visit to a 50-year-old patient who was recently hospitalized with a right leg deep vein thrombosis and a pulmonary embolism. The patient's only medication is enoxaparin or Lovenox. What is it? Subcutaneously. I was going to say that wrong. But the patient, where was I? Which assessment information will you need to communicate to the physician? All right. So enoxaparin, right? Think about, what does that medication do? It helps with what? Clots, right? Helps to reduce clots, right? So let's think about this. Do I want it for a patient that says that her right leg aches all night, the right calf is warm to the touch and is larger than the left calf? All right. The patient is unable to remember her husband's first name, or there are multiple ecchymotic areas in the patient's arm. What are we thinking? So think about this. I have a 50-year-old who was recently hospitalized with a right-left deep vein thrombosis and a pulmonary embolism. So the patient is in the hospital because of these two issues. The only medication that she is on is Lovenox. Which assessment information would I want to communicate to the physician? Now think about it. If she came in with a deep vein thrombosis, and PE, what are the signs and symptoms of those two disease processes? What are the expected outcomes for those two disease processes? Right? Which one of these doesn't fit that? Well, let's see what the answer is. The answer indeed is C. The answer is C. Confusion in a patient this age is unusual and may be an indication of an intracerebral bleed associated with enoxaparin use. Yes, shout out to you, right? Because of the reduced effect of the antibiotic, which is protamine, bleeding complications can be severe and life-threatening. Level of consciousness, right? Just because she had a pulmonary embolism doesn't mean that she should have confusion, right? Think about pulmonary embolism has to do with the lungs, right? Deep vein thrombosis, we're talking about those clots that are starting in our extremities, right? You second guess, Jenny. So one thing I'm going to tell you is that we don't ever second guess. Your first gut answer, 9 times out of 10 is the correct answer. All right. And also, if you got it wrong, read your rationales, read this to understand why these answers are incorrect and while the other one is correct. All right. You have to get into that mindset. Somebody says surviving poetically. It says pass my NCLEX RN last week. Thank you for these lives. It helped. Hey, you're number 2. Once again, ma'am. Hey, congratulations to you. Welcome to the greatest shit show on earth, known as being a nurse, whether you're an RN or an LPN. Congratulations to you. If there's one piece of advice that you could give to everybody out here, ma'am, what would it be? And once again, congratulations to you. Congratulations to you. All right, here we go, y'all. Hey, look, I already see it. It's a select all that apply question. All right, so I'm going to have multiple answers. All right, Rocky, what site are we talking about? What site? Well, what exactly do you mean? Because I said a bunch of sites. All right, so you are providing care for a patient with recently diagnosed asthma. Which key points would you be sure to include in your teaching plan for this patient? Select all that apply. All right, let's think about it. What is asthma? Congratulations, Ms. RN. There we go. I currently wait to take my NCLEX for PN. I love to see it. Somebody says A, B, and D. Okay. So avoid potential environmental asthma triggers such as smoke. Use the inhaler 30 minutes before exercising to prevent bronchospasms. Wash all bedding in cold to reduce and destroy dust mites. Be sure to get at least 8 hours of rest and sleep every night. I wish I could do that. Or avoid foods prepared with MSG. What are we thinking? Got a bunch of people saying A, B, and D. A, B, and D. Hey, we're on the road to 30,000 likes. It says, don't we all need sleep? We really do. We all need sleep. Hey, there's a good book out there called Why We Sleep. I recommend everybody read it. It's called Why We Sleep. It will put you to sleep. And the author does that on purpose. All right, let us see. Let's see what's going on. All right. Most everybody's saying A and B. We've got some A, B, and D, so we'll see what's up. Let us see. My man, AJ, is in the building. AJ, let him know what's up. You sick, Kevin? No, I'm not sick, Gabrielle, sorry. I'm not. But the answer is A, B, D, and E. Asthma comprises a range of diseases and has a variety of heterogeneous phenotypes. The recognized factors that are associated with asthma are a genetic predisposition, specifically a personal or family history of atopy. So eczema, if you got it, hay fever, you can get asthma, other allergies, right? Environmental factors or environmental control is vital if one wants to avoid reoccurring actions such as, pollen can do it, dust mite can do it, tobacco smoking can do it for sure, right? Think about those beta 2 agonists, okay? What else? What's the other one down here? The weather for sure. Whether it's due to symptoms of asthma or just staying up too late, missing sleep can make asthma worse. It can. I had A and D. That's okay. That's okay. I'd rather you get it wrong here than get it wrong somewhere else. And then, of course, food allergies can do that too. So depending on what certain foods that you eat, they can trigger your asthma. All right. So shout out to everybody that got that question right. Hey, if you guys are just now joining, we are doing NCLEX questions. I got them off nurseslabs.com. We are on the road to 30,000 likes. Hey, if I don't have 30,000 likes by the time I got to question 20, because yes, we have 20 questions, maybe 21 questions, 50 cent style. Make sure you guys share. All right. Here we go. Question number 18, you are providing nursing care for a newborn infant with respiratory distress syndrome who is receiving nasal CPAP ventilation, all right? What complications should you monitor for in infants? Pulmonary embolism, bronchitis, pneumothorax, or pneumonia? What are we thinking? You're guessing? Hey, I'd rather you guess. Hey, here's the thing on NCLEX, if you don't know, you have to guess, all right? Think about this. You're going to guess. So think about it. How can you get a pulmonary embolism? How can you get it? How can you get pneumonia? What is it? Right? Bronchitis, how can you get it? That's where you have to understand this. That's pathophysiology 101. All right? That's where you have to use your critical thinking in order for you to make a clinical judgment. All right? So let us see. I'll give you guys 10 more seconds. Somebody says C or D. Okay. Bronchitis is bacteria. Okay. I want to say D because VAP. Okay. But so you want to say D because of VAP, but they're not on the ventilator. They're not on the ventilator. All right. But let's see. Here's our answer. And by the way, CPAP is not the ventilator. It says ventilation. It doesn't say ventilator. See what I'm saying? But the answer is C. It is a pneumothorax. The most common complication after birth for infants with RDS is a pneumothorax. Alveoli rupture and air leaks into the chest and compresses the lungs, which makes breathing difficult. Pulmonary air leak syndromes such as pneumothorax and the pneumomediastinum may also present as respiratory distress, but the onset of symptoms may be more acute. All right. It may be more acute. Well, the NCLEX review on help prepare me for ATI predictor. Paige, I don't even know I've never used the ATI predictor. I couldn't even tell you what that is because my school didn't use it. We used HESI, but this will prepare you for sure for NCLEX because I'm not going to say that it does and it doesn't. Because I've never taken the predictor, so I really couldn't give you an answer. I'll be very transparent about that because I've never taken it. But I can tell you right now, it'll definitely help you for your NCLEX for sure. But shout out to everybody that got this question right. I appreciate everybody smashing that like button and giving me 30,000 likes. But hey, we got some more questions. Let's see what's up. How much is the NCLEX review? So if you do the NCLEX review is $197. And we're going to be doing it for 3 days. It's going to be live where you get to hear and see me. And we're going to go over all 8 sections of the NCLEX client needs. We're also you're going to get 90 days of the 7-day NCLEX course, which is on demand. You get to be a part of my NCLEX community where I also do live videos. And you're also going to get my ebook. And and if you happen to miss the live, you get the replays. All right. But here we go. Question number 19. You're responsible for the care of a post-operative patient with a thoracotomy. All right. Is it Nadia? You're welcome. The patient has been given a nursing diagnosis of activity intolerance. Which action should you delegate to the nursing assistant? Remember, the nursing assistant is the UAP. The nursing assistant is the UAP. Sherry says, taking the NCLEX April 8th, is it possible to just do the 7-day review? Yeah, you can do that. You can go buy it and be a part of it for $7. And then if you like it, you stay in it. If you don't, then, you can just cancel your subscription. It says, question, the 7-day NCLEX course, how is it scheduled per day? Like how many hours is only $7? So Naomi, it's on demand. It's on demand and it's open. So if you want to go through it in the span of 3 days, you can. If you want to go through it however long, you can. But it's on demand. The 7-day NCLEX course is. Plus, you have all the content to back up whatever issues that you're having. All right. So, I didn't even get to read the answers. That's okay. We'll read them. Instructing the patient to alternate. Rest and activity periods, encouraging monitoring and recording nutritional intake, monitor cardiorespiratory response to activity, or planning activities for periods when the patient has the most energy. And the answer is B, encouraging monitoring and recording nutritional intake. All right. The nursing assistant's training includes how to monitor and record intake and output. After the nurse has taught the patient about the importance of adequate nutritional intake for energy, the nursing assistant can remind or reinforce and encourage the patient to take in adequate nutrition. All right. Remember, as registered nurses, we do not delegate what we eat. We do not delegate what we eat. Nadia, I don't know why we're covering our eyes. Well, I don't know what's going on. But make sure. You have to make sure you have to know scope of practice. This falls under delegation, assignment, supervision, which is under management of care, which is the largest section of the NCLEX. All right. So shout out to y'all. Make sure you guys circle back and get that content. All right. Here we go. Question number 20. You are supervising a nursing student who is providing care for a patient with a thoracotomy with a chest tube. All right. What findings would you clearly instruct the nursing student to notify you about immediately? So, hey, nursing student comes to you and says, nurse so-and-so, you got to come and look at this. Meaning you got to come and look at this cliche, right? Is there a 3-day live? Is the 3-day live used for? Yeah, yes, absolutely. So if you're a repeat test taker, come on. If you're taking it for the first time, come on, bring yourself. All right. So is it A, chest tube drainage is 10 to 15 mLs an hour, continuous bubbling in the water seal chamber, complaints of pain at the chest tube site, or chest tube dressing dated yesterday? Royal says, new here, praying I get into nursing school this fall. Royal, you can pray all you want, but I'm going to ask you, although you're new here, what work are we doing to get into nursing school? And also, Royal, here's something else I want you to remember is I want you to apply at every nursing school that you can. Everybody is so stuck on, I only want to go to this big university. Let me tell you something right now. Nobody cares what school that you went to as long as it is accredited and you pass your NCLEX and you're not part of like that fakeness. E-money in the building. All right. So you will get into nursing school. Speak it into existence and it shall be so. All right. You can hope and pray all you want, but hope is for people that are in the Star Wars universe. I'm just letting y'all know. All right, but here we go. And the answer is B, continuous bubbling in the water seal chamber. Hey, if something is supposed to be completely sealed, there should be no bubbling. So think about it like that. If there's continuous bubbling in the water seal chamber, that is a bad, and we don't want that. All right, so continuous bubbling indicates an air leak that must be identified. With the physician's orders, you can apply a padded clamp to the drainage tubing close to the occlusive dressing. If the bubbling stops, the air leak may be at the chest tube insertion, which will require you to notify the physician. If the air bubbling does not stop when you apply the padded clamp, the air leak is in between the clamp and the drainage system, and you must assess the system carefully to locate the leak. I'm telling you right now, gloved hand, petroleum gauze, 2 clamps. It says failed NCLEX or failed 5 times. Can I use your? Absolutely. You sure can. Hey, listen, remember, I failed NCLEX 3 times, ladies and gentlemen. I failed it 3 times. All right. And by the way, everybody wants to talk about the review. Here it is. You can join the live NCLEX review that is going on April 12th, 13th, and 14th. Included with that, we're going to go over live lectures. We're going to go over and we're going to break down questions to include new generation NCLEX questions, as well as those other questions. We're going to talk about case studies. We're going to talk about test taking strategies, trigger words to look out for, right? As well is we're going to, hey, as a bonus to y'all, I'm going to give, Katie, it is not free. It's $197. All right. I am going to give to you my complete NCLEX victory guide, which is over 700 pages. I kind of went overkill, but you're going to get it. It's a part of that, right? You're going to get access to the on-demand 7-day NCLEX course, as well as you're going to get access to the NCLEX community where I also do lives throughout the week. All right. So if you are interested in that, hey, seats are filling up fast. I only have a limited amount of seats. All right. Because I want this to be small. I want it to be intimate. I want to be able to answer people's questions. I want it to be very engaging. All right. So I capped it. And if you don't hit that cap, then you're going to miss out on it. So I recommend that you go do that before I cut it off. Guys, go check that out. thebootnurse.com/3-day review. All right. Shout out to y'all. But here we go. Question number 21. Question number 21. You are supervising a student nurse who is performing tracheostomy care for a patient. For which action by the student would you intervene? So the student is doing something incorrect. So what should we do as the nurse to fix them? All right. What should we do as the nurse to fix them because they are doing something incorrect? Are they suctioning? Should we correct their suctioning of the tracheostomy tube before performing tracheostomy care? Removing old dressings and cleaning off excess secretions, removing the inner cannula and cleaning using universal precautions, replacing the inner cannula and cleaning the stomach, changing the soiled tracheostomy ties and securing the tube in place. What are we thinking? What are we thinking? Somebody's telling me C. Nadia is telling me A. Hey, shout out to all y'all that are out here rocking. We are doing NCLEX questions. I got them off of nurseslabs.com. They are free sets of questions. You guys can go over there and check it out for yourself. Tweedledee says it's sterile. Okay. It says, how long will you leave the 3-day live open? Hold on one second. The 3-day live open. So the 3-day live, hold on one second, because TikTok is trying to kick me out for some weird reason. Like Netflix. Are you still here? You know I'm still here. So right now, the live is going to be left open for 90 days. The live is going to be open for 90 days. But I very much could change that. And I'm thinking about changing that. But as of right now, it's going to be 90 days. But for everybody that gets in it, you're at least going to have it for 90 days. All right. But then I could change it. And if I change it, I'll let the people that are a part of that, I'll let them know. But the answer is C, removing the inner cannula and cleaning using universal precautions. Somebody said it. That is a sterile job. That is a sterile thing that we have to do. Why? Because that cannula is bypassing the body's natural filtration going directly into the lungs. So you're trying to give somebody pneumonia? You're trying to have somebody get all sick out here? No, we don't want all that. You were thinking C, but did you pick C? Chocolate dropper. You see what I'm saying? If you were thinking C, and if that was your gut answer, most definitely you definitely want to get in, go with your gut answer all the time. All right. Do you do new gen on live? I have done new gen on live before. Yep. I've gone over case studies. And I'm going to be going over some more of those as well. All right. And like I said, inside of my review, I'm actually going to be going over, case studies as well. All right. But here, the biggest thing about case study, here's the thing is the questions, the answers are still going to be the same. It's all about how everything is delivered to you. All right. The case studies are what the biggest thing that has been added, but the content has never changed. The new gen significantly different. The only thing that's different is how the questions are asked to you. They give you tons of information inside of the case study, but the questions don't change. They're still select all that apply. You have to know what's anticipated, what's not anticipated. You have to know what you anticipate the disease process is going to be, or what you think the doctor's going to order. You know what I mean? Those are the things. Those are the things that this test is going to ask you. Question 22, you are supervising an RN who was pulled from the med-surg floor to the emergency department. The nurse is providing care for a patient admitted with an anterior epistaxis, so a nosebleed. Which of the following directions would you clearly prove to the RN? Select all that apply. So there's going to be more than one answer. All right. There's going to be more than one answer. All right. It's rarely ever all of them, and it's rarely ever one answer with a select all that apply. All right. And that just depends on how many answers that you get. So position the patient supine and turn on his side. apply direct lateral pressure to the nose for 5 minutes, maintain universal standard precaution standards, substance precautions, apply ice or cold compress to the nose, instruct the patient not to blow the nose for several hours. What are we thinking? I think this is actually probably one of those questions I omitted last time because it looks familiar because it might be wrong, but I still want y'all to answer. We're going to figure it out. All right. Hey, if you guys are just now joining, we're doing NCLEX questions. My name is Kevin. I've been a registered nurse for almost 4 years. I work ICU, OR, and PACU. I want to know who you are and where you're from and where you're at in your nursing journey. Hey, by the way, get us to 40,000 likes. 40,000 likes right now. Make it happen. Hey, and share it. Hey, if you're in nursing school right now and you haven't shared this with anybody, you're wrong. I need for you to fix yourself. All right. But the answer is B, C, D, and E. Epistaxis is relatively common, but rarely fatal, right? Anterior bleeding is usually managed by digital pressure, general chemical cauterization, or nasal packing. Posterior bleeding, which is less common, is characterized by a massive bleeding that's initially bilateral. This bleeding may be more difficult to control. Now, for B, it says, tell her to breathe through her mouth while holding firm pressure to the soft flesh of her nose for at least 10 minutes. All right. Now with C, it says always use universal precautions. You need to put on a gown, you need to put on gloves, you need to put on a face shield. Why? This patient is bleeding. You don't need nastiness like that all over you. What if they sneeze and they sneeze blood in your face? That's what you want? And also, yes, the NCLEX with Select All That Apply, they do give partial credit on Select All That Apply questions. I'm telling you right now, I don't know what that is like in real life because I didn't have that as an option in school or when I took the NCLEX. All right. So it says, love, they gave partial credit now for the NCLEX for sure. I had this happen when I was doing my nursing internship. Kathleen, tell us about it. Tell us about it. All right, here we go. Question number 23. You are the preceptor for an RN who is undergoing orientation to the ICU. The RN is providing care for a patient with ARDS who has just been intubated in preparation for mechanical ventilation. You observe the nurse perform all of these actions. For which action must you intervene immediately? So the nurse that is being precepted, the new nurse on orientation, did something wrong. So us as the experienced nurses need to step in because she did something wrong. What would that be? It says the new NCLEX is very straightforward. It is straight. I mean, even the old NCLEX was straightforward. Like you got Select All That Apply questions and you got multiple choice questions. The only thing, this is actually more straightforward because you're given way more information. They take a lot of the guessing out by giving you case studies because all the information is there. It requires you to use critical thinking. Pull them. You pull all of nursing school into a question. All right. Are they assessing for bilateral breath sounds and symmetrical chest movement? Auscultating over the stomach to rule out epigastric intubation. Mark the tube 1 centimeter from where it touches the incisor tooth or nares. Ordering a chest x-ray to verify that tube placement is correct. Do I think they dumbed it down? No, I don't think that. If they dumbed it down, then a lot more, then nobody would fail it. You know what I mean? But the NCLEX did increase. The NCLEX pass rate did increase over the last 2 or 3 years. Like it went from 79% to 88%. But then again, it was in the mid to high 80s nationally, years before COVID. And the NCLEX is hard. It is a hard, difficult test because if you don't know how to approach the question and how to break it down tactfully, you could very easily get the question wrong. How to narrow critical thinking. You have to be able to pull it. You do your critical thinking based off of what they're asking you. All right, but let's see what the answer is. I think it was this one. It says, so mark the tube 1 centimeter from where it touches the incisor tooth or nares. The endotracheal tube should be marked at the level where it touches the incisor tooth or nares. This mark is used to verify that the tube has not shifted. If the patient has an endotracheal tube, check for tube slippage in the right mainstem bronchus, as well as inadvertent extubation. I don't even like the way that's worded. I think this is another one I threw out before. But yes, Michelle says you must know your content. That's the thing. There's no tricks to taking this exam. Some people are just like, I'm going to show you some tricks. There's no tricks. It's called putting in the fucking work. If that's a trick, then hey, Avada Kedavra. I don't know. I didn't know what to say after that, but I'm just letting y'all know it's not a game. It's not, and it's not meant to be easy. Some people say it's easy, but I'm telling you it's not. You know what I'm saying? He said, I agree. Not a good question. Yeah, this is not a good question. I don't like the way because all of them they can do. This, and in reality, what should have been done should have been like, what do we do first? But I don't like that. Anyways, I'll omit that one. Everybody got that question right. It says abracadabra. I said Avada Kedavra. All right. I'm just letting y'all know. Let me know where y'all know that's from. Anyways, here we go. Question number 24. Wait, Bull says, what do you recommend for content? So, Bull, inside of my 7-day NCLEX course, I have content videos. My pharmacology section has 18 videos in it, telling about all the important pharmacology things that you need to know for yourself. And I just uploaded 10 videos inside of my cardiology section. And now I'm actually about to start recording stuff for mental health, as well as I'm looking into I'm recording and getting my stuff together for pediatrics. So I'm just saying, all those videos in there, they are super, super helpful. All right, but here we go. Question 24. You have just finished assisting the physician with a thoracentesis for a patient with recurrent left pleural effusion caused by lung cancer. The thoracentesis removed 1,800 mLs of fluid. Which patient assessment finding is important to report to the physician? All right, so somebody was asking about critical thinking. All right, so we're talking about lungs. Where's a thoracentesis? Like, where do we do it? So we're talking about lungs. All right, we're talking about lungs. So let's keep it to the area of what we're thinking about. All right, so now I'm like, in what direction will this go? This is where understanding your content will help you with your critical thinking when you have questions like this. All right, so a patient starts crying and says she can't go on with treatment much longer. The patient complains of sharp stabbing chest pain with every deep breath. The patient's blood pressure is 100/48 and has a heart rate of 102. Or the patient's dressing of the thoracentesis site has 1 centimeter of blood drainage. What are we thinking? What are we thinking? What should be reported? What should be reported? I got a bunch of people telling me B, a bunch of people telling me C. Okay. Think about that. Think about it. Shout out to everybody that's here rocking with me. We're doing NCLEX questions. Got these questions off on nurseslabs.com. They are free sets of questions. You guys can go over there and check them out for yourself. I'm also doing a 3-day live NCLEX review, April 12th, 13th, and 14th. We're going to be going over all 8 sections of the NCLEX pie. I'm actually going to be breaking questions down just like this and going through trigger words and going way more in depth. All right, so that's what I'm going to be doing. You guys are going to get a whole bunch over there. Make sure you guys go over there and check that out, thebootnurse.com/3-day review. But think about this. What is the expected outcome of somebody who has a thoracentesis? Would I expect for them to cry and say that they don't want to do this any longer? Would I expect that? Do I expect for them to have a sharp and stabbing chest pain on every breath? I mean, where's the thoracentesis done? All right. They just had a thoracentesis. They just had a procedure done. Would I expect them to have drainage, bloody drainage? That's 1 centimeter. Would I? What's unexpected? What would require me to call the physician? And the answer indeed is C. Right? The patient's blood pressure is 100/48 and has a heart rate of 102. Both not good. That blood pressure is trending down and that heart rate's going up. Why? What's going on? Getting shocky, like Jeremy Shockey? I got you, Nikki. All right. So that's what it is. Hupo. What's hupovolemic? What's hupo? Do you mean hip? Do you mean hypo? I got you. No, but so removal of large quantities of fluid from the pleural space can cause fluid to shift from the circulation into the pleural space, causing hypotension and tachycardia. Causing hypotension. That's funny. The patient may need to receive IV fluids to correct this. All right. Yeah, they may have, because now they're having a fluid shift issue, right? So now we gotta fill the pipes because the pipes ain't doing what they're supposed to be doing. So there's a leak somewhere. We got to fix it, right? Because it's shifting. All right. So shout out to everybody that got that question right. Fluid volume issue. Correct. Right. Hey, anytime you start to see that blood pressure go down, that's a fluid volume deficit, meaning that they don't have enough. And this patient is trending that way. Why? Because I just took 1,800 mLs of fluid out of the body, right? And I caused them to be hypotensive. All right. Hupotensive. Hey, that's hilarious. Here we go. Question number 25. It says, anytime blood pressure is down, heart rate's up. That is not good. That is very true. But we didn't have a blood pressure. We didn't have a first blood pressure. You don't have to have a first blood pressure to know that. Okay, so here's the thing, Katie. What's a normal blood pressure? We know our normal blood pressure is 120 over 80. We know that, right? But I do know that somebody that just had a procedure done, right, had a bunch of fluid taken out, right? Fluid that's supposed to be in our vessels, keeping everything up. I do know that that trended down from something that is considered normal. Does that make sense? If that makes sense, give me the 40,000 likes. Stop playing games. All right, here we go. You have obtained the following assessment information about a three-year-old who just returned to the pediatric unit after having a tonsillectomy. All right, think about where are the tonsils? Kevin, they're on my knees. First of all, what tonsils you got on your knees? Stop it. Which findings require the immediate follow-up? So what's happening to my patient, right? Is it frequent swallowing? Is it hypotonic bowel sounds, complaints of a sore throat, or a heart rate over 112? What are we thinking? Everybody's telling me A. We got some people out here saying B. Royal is saying A. I just want to sing that song. You can never be royals. Yanni is telling me A. Fitz is telling me A. What else are we thinking? What does hypotonic bowel sound like? So let's break that down. Is it blazy? First off, let's ask, do you know what those mean? This is a big part of medical terminology. Hypo meaning low, right? Bowel sound. So I'm listening for, essentially the movement and contractions of my stomach and my intestines, small and large, right? So hypo meaning low or slow. Hypo meaning low or slow. So, or absent, soon to be absent bowel sounds. All right. That's what hypotonic bowel sounds mean. All right. It says this baby is swallowing blood. Swallowing equals possible bleeding. Little. Thank you. I'm just in high school student here. It's for fun. Okay. See, that's why I asked you, like, we got to know, like, we meet everybody where they are with regards to, their learning and their education. So you're still in high school. So you're going to learn all this stuff as you start to progress through, medicine. All right. Here we go. But yes, the answer is correct. It is A, frequent swallowing. Frequent swallowing after a tonsillectomy may indicate bleeding. Right? Which if they're bleeding in the back, that means now they're going to have a circulation issue, but now they're swallowing their blood, which can now become an aspiration issue, right? Now they're having a circulation issue on top. They can end up having an airway issue, right? So you should inspect the back of the throat for evidence of bleeding. The other assessment results are not unusual in a 3-year-old after surgery, right? Because a 3-year-old's heart rate is well over 100, correct? Think about it. Think about those things. Think about those things that are expected versus unexpected. That is how we separate things. All right. So shout out to everybody that got that right. If you got it wrong, circle back and understand why frequent swallowing is a very important thing to look out for kids that get tonsillectomies. All right. Bleeding issue, possible airway issue. We don't want that. All right. We don't want our kids or anybody to have that. All right. But of course, ladies and gentlemen, if you're one of those people who failed your NCLEX multiple times, you don't know where to start. You don't understand how to read your CPR. You don't have accountability. You want help creating a study calendar. You want help to know, hey, where do I go from here? You know what I'm saying? You need mentorship. I used to be that person, and I'm offering that to y'all because it was offered to me. You guys can check that out, thebootnurse.com/coaching. Everybody needs something different. Everybody needs something different. Some people need a little bit. Some people need a whole lot. And I meet you where you are. The whole point is to get you to pass your NCLEX, period. That's what this coaching is for, and let you know, hey, what the things that you can do after that. And if you're interested in getting coached one-on-one with me for well over an hour, you get tired of me, trust me, you get my phone number, right? Like we talk like you get a bunch of stuff. And if that's something that you're interested in, you guys go check my website out, fill out the questionnaire. All right. And then schedule a call with me. All right. And let's get you over that hump. Let's see if coaching is right for you, because coaching is a relationship, ladies and gentlemen. It is a relationship. Who wants to be in a relationship with somebody who bickers at them all the time? Nobody. All right. We have to vibe. and I want to make sure that we vibe, because my goal and only purpose is to mentor you, to guide you to pass that NCLEX. And that is it. All right. It says, thank you. Listen today while working out, worked on my mind and body. Jenny, I love to hear it. I love to see it. I recommend this person. What? I recommend this person no conflict of interest. What you mean, hippie? Am I late? You are late, because that is the end of it. Is it Vival? That is, yeah, you are late. We are at the end of it. My aunt is a nursing professor at a different school than mine. I love having her on call. I bet you do. All right, but ladies and gentlemen, I appreciate you guys hanging out. I appreciate you guys hanging out while we went through some NCLEX questions. I appreciate all the likes and gifts, although I didn't get any, while they're not required. They are always appreciated. Once again, you guys can check these questions out. They're free sets of questions. Check them out. All right, nurseslabs.com. Hey, I am doing a live 3-day NCLEX review where we're going to be breaking down the NCLEX test plan. We're going to be going through some content things, trigger words, understanding what the NCLEX is, because a lot of people don't know what it is. All right. And we're going to be talking about that over a 3-day period. You guys get 90-day access to my review as well as to my community. You get the replays for the live. So if you happen to miss it, you get to review it and go back through it. And you also get my ebook, which is over 700 pages of just awesomeness. All right. I kind of went overkill, but overkill is not so bad, right? It's broken down very simply for you. All right. 7-day NCLEX course. If you don't want to do the review, you can do the NCLEX course on demand, and you can join that for $7. $7 for 7 days. After 7 days, it's going to go to a monthly subscription of $97. So don't say I didn't tell you. You know what I'm saying? Also, make sure you guys check out my book, Conquer It, on how I conquer the NCLEX, because trust and believe me, it will be very, very beneficial for you when it comes out. It's coming out on my 4-year anniversary, which is June 5th. All right. And if you want help, one-on-one coaching for the NCLEX, you can check that link out in my bio, thebootnurse.com/coaching. Everything is inside. Zach, what is the deal, my guy? Everything is inside of on my link tree on my main page. All right. It says, what does the ebook have in it? So on the ebook, I have EKG interpretations. I have tons of pharmacology. I have management of care, delegation, supervision type of questions. We go over growth and development. It's very helpful for both RNs and LPNs. All right. And it's 780 pages or something like that. All right. But shout out to y'all. Y'all got me to 40,000 likes. I appreciate y'all. Your boy got a haircut yesterday, because now I don't know how to act. Now I don't know how to act, you know what I'm saying? So, but hey, if you guys are new here, my name is Kevin. I've been a nurse for almost 4 years. I worked ICU, specifically a burn and a medical ICU. I worked OR and I worked PACU. I was in the Navy for 16 years. I got out just this past January because, hey, when it's your time to go, listen to me. It doesn't matter what you're doing. When it's your time to go, it's your time to go. All right. And don't let anyone make you feel guilty about anything that you are going to do for yourself mentally. All right. Zach, I appreciate your support. Thank you, sir. Thank you. I appreciate it. Royal, you are very welcome. Also, I failed my NCLEX 3 times. 3. I failed it 3 times, ladies and gentlemen. And let me tell you something. Nobody cares. Like, nobody cares. They don't. And nobody's out here worried about you either. Nobody's going to be like, You know, Zach failed 3 times, right? Don't nobody give a shit. Nobody says that. And even if people do say that, fuck those people. Oops. Sorry, I said the F word. Sorry. Who cares? Though, if people talked about you or talked to you like that, they were never part of your circle. They were never part of your circle for anything. Sorry. Hey, let me tell you something. I check people, and I check them often. I'm like, you're not going to talk to me like you lost your mind, and you're not going to talk to other people who are fighting to get here like you lost your mind. It says, I would be a great nurse without passing the NCLEX. Well, you're not going to be a nurse if you don't pass the NCLEX. So you wouldn't be a great anything unless you pass the NCLEX. That's what makes you a nurse. That is the rite of passage. Trust me, everybody is just like, man, I wish I didn't have to do this. And this isn't saying anything about your hands-on skill, because your hands-on skills could be very much, be that thing. But everybody has to go through that rite of passage. Everybody. I said the same thing. I was like, well, I got to take this stupid ass test. But you realize that test is meant to keep people out who don't belong. All right. That's why. So what questions do you guys have? And if you're new here, like I said, we just did NCLEX questions. We went through them. They're all gone. Sorry. Oh, what the hell? Stop playing on my phone. I don't know what's going on over here. Anyways, so what do y'all think? What are we doing? What do y'all think? What questions do you guys have? Katie says, preach. Katie, look, this is your second time here. You know what's up. You know what's up. It says the live is for repeat. The live is for repeat NCLEX test taker. The live is for anybody that wants to take it. If you're a first-time taker, if you're a first-time test taker, yes. If you're a repeat test taker, absolutely. What state are you in? I live in Texas, the great state of Texas. I don't care what none of y'all say. And no, I would not want to live in California. I mean, it's nice over there, but, you know, I like Texas better. It says they are not part of your three. Hey, let them know, Sherry. Let them know. It says having to take the NCLEX multiple times doesn't mean that you're going to be any less of a nurse. Absolutely. The exam does not determine what type of nurse that you're going to be. If you end up being a shitbag, it's not because of the exam. You're a shitbag because you suck and you're a shitbag. That ain't got shit to do with no exam. I've met people, everything in between, who passed the NCLEX the first time and is a shitbag of a nurse, who took the NCLEX multiple times and is probably one of the phenomenal nurses I've ever seen. Tons of them. It doesn't matter. It says, we owe you. I will give you some money when I hit my $1 billion Powerball. Hey, go ahead and slide me that. How do you deal with your exam anxiety? Kay, the biggest way to deal with your exam anxiety is to create the exam before you get there. And every time you take an exam, make it as if you are sitting for the NCLEX. Promise you. It says, hey, Kevin, I got to run. Thank you for another good time. Of course, Samantha, I'm glad that you were here. You go have a good rest of your night. It says, can we take notes? Absolutely. You absolutely can take notes. And you got to think, you're going to get the replay. So if you want to go back at any other point in time and take down notes, you surely can. Somebody says, I've been a nurse for 26 years. Nikki, no, you have not. Why are you lying to me? I'm looking at your picture right now. You have not been a nurse for 26 years. Stop lying. And I love following your lives just to see if I still know my stuff. Well, you're in here participating. So Zach says, do you need a moderator? Zach, you want to be a moderator? Bro, I got you. I'll make you a moderator. I'll make you a mod right now. How about that? Zach, but if you fuck up, I'm telling you right now, I will fire you. You understand me? Kay says, thank you. Yes, I have. I say 26 years is because you don't look like you look very young. You see what I'm saying? You look very young. All right. So, and first of all, that's a compliment, man. Okay. So shout out to you. But hey, what other questions do you guys have? Who has questions about NCLEX? Who has questions about nursing? You got tons of people that are in here, everybody in between, people that are in high school, as well as somebody who's been a nurse for 26 years that is in here doing her thing. And obviously she still has it. Is Archer similar to the NCLEX? Yes. And so is UWorld. UWorld is they're both just even based off of the format. It says, how do you feel about boot camp? I don't know. I've never used it. I've heard about I think it's called NCLEX boot camp, but I have never personally used it. I never have used the boot camps. I mean, if you ask me how I feel about boot camp, like in the Navy, I could tell you all about that. I did that in 2007. So that was cool. But shout out to all 128 of y'all. Hey, we did NCLEX questions. I got them off nurseslabs.com. Make sure you guys go over there and check those out for yourself. It says, what did the people do to help you accomplish your NCLEX on the passing attempt? So it was more of the mentorship and the guidance of just pretty much telling me where I did wrong and answering all my questions, essentially what my coaching and what my mentoring does. Boot camp here in 94. Shout out to you, Sherry. I went to boot camp. How old was I in 94? I was 7. I don't know how you feel about that, but I'm just letting you know. Do you have a podcast? Kay, I do not have a podcast. You and many of other people have told me I should start a podcast. One of my friends who's a nurse practitioner, she wants to do a podcast. But I told her if we do it, she's heading all of it up. I'm not doing it because it's a lot of work. It says looking good. Hey, look, I'm doing my thing. I got some gray hairs in here. You know, that's like kids, deployment, you know, you name it. It's all there. I hate the case studies and farm. Well, you better love the case studies and you better love the farm because believe it or not, especially if you go critical care, case studies and pharmacology is never going away. If you want to be like Redonda Vaught out here, I'm just letting you know. Hey, you better learn your pharmacology. It says, do I need to remember everything in A&P and 2 out of class? Yeah, you need to know your A&P. You need to know your anatomy because if I say, hey, go put it in their deltoid, and then you tried to put it in their thigh, we're gonna have a problem. How do I feel about Saunders? I mean, I didn't like Saunders at all. Plus, it's a book, and I don't really like the books. Like you put a book in front of me, your boy's falling asleep. Just saying. So, but what other questions do you guys have? We're talking about NCLEX. We did NCLEX questions. Hey, I am doing a live 3 day 3 day NCLEX review. A live 3 day NCLEX review. You guys can check that link out. It is in my bio. I'm doing it April 12th, 13th, and 14th. And we're going to be going over everything that you need to know for NCLEX. What was the hardest class in nursing school? That depends. Some people it's pharmacology. Some people says it's med surg. Some people say it's fundamentals because fundamentals is where it brings everything. Fundamentals is the beginning. Foundations is the beginning. But I would say it would be a combination. I honestly probably med surg. I would say med surg. How do I feel about Mark K? Love Mark K. Pass point? Know nothing about it. Your best grade for nursing school? Great. So if you don't read, what do you use? I use videos. So I was using YouTube, but then when I passed NCLEX, I used Kaplan, and they have tons of videos as well as they have an ebook, which is why I have an ebook as well as I also have content videos. I have heard of Pass Point. I've never used it. Pass Point, I think, just became a thing recently, I think. So you mean to tell me you remember every bone and muscle in the body? I didn't say I remember every bone and muscle in the body. However, I'm very familiar about the bones and the muscles that I know I need to use. Do you have an app? So I don't have an app per se. However, the website generator that I use, they have an app and it allows you to get access to my program. So yes, it's the Kajabi app. MedSearch for sure. Candace says, hey, nice to be here. Candace, I'm glad to have you here. Hey, if you guys are new here, I want to know who you are, where you're from, where you're at in your nursing journey. Everything Mark K talks about will definitely help you with the NCLEX. 100% it will. 100% it will. Mark Klimick was the solidifying person that pushed me to create my own review. I've been teaching. I've been an instructor for almost 10 years. I was a master instructor in the Navy. I was a surgical tech instructor for about 3.5 years. I also taught pre-hospital trauma, ACLS, advanced burns, pre-hospital trauma, tactical combat casualty care. I've been on 2 deployments. So teaching has just been my thing since I pretty much have been in the Navy. So, it says, what do you think about CRNA? My dream job as a high school senior. CRNA is by far, it is the most highly paid nurse in the nursing field. It's very hard. They're difficult schools to get into, also difficult schools to get through because they're very, very intense, but very, very lucrative at the end of them. So the CRNA is where you want to go. I'm going to tell you, go to nursing school, get into critical care, get your critical care experience, and then apply. It says nursing money and military money, you are loaded, but no, not at all. So I want people to realize that the nursing money is not really as much as you think it is when you first start out. Now, when you start traveling, that's a different story. If y'all want to know a lot about making money, go to my girl, Larissa. She is also a nurse educator. She's a nurse practitioner, and she will tell you how to make money out here with real estate and how to pivot and put your money in places. I also have already been doing that before I met her. But as a nurse, put it this way, the most highly paid RNs or LPNs, they live out I'm pretty sure it's in Northern California. I'm pretty sure. It says, Brandy from California, love your lives because you add in comedy. Brandy, look, this is just like my normal demeanor. When I do my live NCLEX review, it's going to be the same. I'm actually going to be doing a live in-person review as well. Here comes soon in the near future. And I only imagine if you get to see me in person when I do it, right? So it says, thank you. I got 8 weeks, and this will be my second time, and I'm using Mark K. Shout out to you, Kimmy. Is it Nurse Kimmy? It says, do you have any tips for the Certified Patient Care Tech test? I don't. I've never taken it, so I don't even know exactly what they would ask you. Is it SAVE or SAV? It says, first time with Nurse Remar, and I'm assuming UWorld. My second time. Is Mark K lectures? Do I need something else? My opinion, you don't use a lot of stuff. Like if you were hanging out with Nurse Glamber, aka Nurse Amber, she's also an NCLEX strategist and she's a homie. She'll tell you to use 3 things. I'm one of those people to tell you don't use more than 2. Don't use more than 2. So you don't need anything. Like you got Mark K, cool. You got UWorld and Remar, cool. Don't use anything else. Because all you're going to do, you're going to start to confuse yourself because certain little things that people are going to say, you're going to start to pick out. You're going to be like, wait a minute. They said potassium is 3.5 to 5.0, but they're saying 3.5 to 5.3. And then you're just going to confuse yourself over no reason. But because on NCLEX, it's not even going to be that close. You know what I'm saying? It says, do you think it's better to get a bachelor's in nursing and then get your experience or get an associate's. So if I knew what I knew now, I would have got my associate's, because you'll get into the nursing field faster. It's a 2-year degree, and then you can not bridge. You can take your bachelor online, and then if you want to take your master's online, depending on what you want to do. How long do you have to wait between taking and a repeat exam? 45 days. How long does it take to get your results back, Katie? So, it usually takes. You can get your unofficial results through Pearson VUE. If you pay $7.95, you can get them after 48 hours. And then for your license to actually post, it could be anywhere from 2 to 4 weeks. It all just depends on how fast your board of nursing works. All right. It says, I just passed my NCLEX, only use Mark K and UWorld. Shout out to you, Adriana. Welcome to the greatest shit show on earth, known as being a nurse. So you just passed your NCLEX, only use Mark K and UWorld. I remember I used Mark K and UWorld. Didn't work for me. Didn't. I used Mark K and UWorld twice, and it didn't work for me. So it all just depends on how you are. For Adriana, that worked. So shout out to her. By the way, what piece of advice would you give everybody in here, Adriana, when it comes to taking the NCLEX? And once again, congratulations to you. So these things work. It's just how do you use these tools? How properly do you use them? It says, I'm taking my NCLEX Friday using UWorld. I'm averaging 65, and this is my third attempt. Anthony, you're going to rock it. Do you know any companies offering phlebotomy review courses for nurses? I don't, actually. I see a bunch of people that come on my For You page that do phlebotomy, but I don't ever catch their names. NCLEX gives lab values. Yes, they do give you your lab values. However, you need to be able to interpret what is happening with those lab values, right? So if you have low, if you're acidotic, you need to know the trends of what's going to happen to the body and what that question is asking and how you need to answer it. So this isn't me saying that to you, Michelle, as in like you don't know it. This is just me just making a blanket statement. Melanie, thank you for the follow. Anthony, I already answered your question because you're spamming the hell out of this thing. Can you practice without getting an official license? No. I take that back. You can use your temporary license, but once that temporary license expires, you can no longer practice. And if you know anybody that practices doing that is illegal, they will put that ass in jail. From a personal experience, I would get my BSN. Most hospitals will want a BSN. Now, while you're not false about that, most hospitals want you to have a bachelor's. However, they won't not hire you because you have an associate's. What they're going to ask you, or what they're going to tell you, hey, you need to get your BSN. Okay, cool. When do you plan on getting it? Like usually you have a time limit. So for them to be like, oh, I don't hire ADNs, that's stupid. That's so dumb for the simple fact that, there's not enough nurses out here. So for you to just be like, oh, you ain't got a BSN? Fuck you. Like, who does that? No, they don't do that out here. But if you have your bachelor's, it's cool. But like I said, for me, I would go get my associates, because that RN license is the same as the RN license that a BSN gets. Have you ever heard of the NCLEX with no test advisement on faith? I don't even know what you said or what that is. What is that? Please enlighten me. Archer is good. Yes, it is. Thank you all. Have a good night. Sherry, you have a good night as well. Do you know what scores are good on Archer? 60s and above. What's your biggest piece of advice for studying? My biggest piece of advice for studying is time management. Time management. If you don't manage your time, and if you can't schedule out your life temporarily to get over the hump for this exam, you're going to have a difficult time. You're going to be all over the place. Create a schedule for yourself. Recreate the testing environment. So no phone, like listen to me on TikTok, right? No snacks, no drinks. If you're able to create that environment for yourself. Like if you have to be able to try to do that to the best of your abilities. Cut people off who don't need to be there. And also enlisted help. If you need help and you don't understand it, ask somebody and see if they can give it to you. People in my DMs all the time, I have that 99 plus thing in my DMs, and I try to go and answer people's questions all the time. Sometimes it's people trying to sell me nudes, and I'm just like, bro, why would I buy your nudes? The internet is free. Anyways, smash the like button. How do I know if I will pass, Kev? I'm feeling nervous since I am testing on Friday. Like, I don't even, I just trust your, so first of all, I appreciate you trusting my advice. The goal on NCLEX is that you want to get to the hard questions. If the questions are seeming incredibly difficult, that's how you know that you're doing very, very well. But also inside of the review that we're going to be talking about, you can get every question right and still fail the exam. Listen to me. They paid for yours. Hey, look, they paid for you to get your bachelor's. See, look at that. You, listen to me. You can pass every question on NCLEX and still fail because the NCLEX gives you different levels of questions. And the goal is you need to be above. You need to be above the passing standard, and you need to be answering NCLEX types of questions, aka those questions that require you to use your critical thinking and make a safe clinical judgment. Like if they give you a question like, hey, what is a normal blood pressure? That's a memorization question. That's not passing. Now, if I gave you some of these questions that are on here that talks about what do you do first, or who do you see first, or who do you see immediately? What is the initial thing? Now that's what they want. It says, would you ever take the CRNA route? I was going to go the CRNA route, but then I realized it's just like, that was something that I wanted to do when I was 19, all the way up until I was 34, 35. And I was just like, I don't want to do it anymore. And I realized where my love was, and it was education. So I love teaching. Like my passion, it's not even a passion now. It's more of an obsession. So, CRNA is not my gig. It's a company that will get you your nursing license without taking first of all, hey, all right, hey, we're coming to a hard pause. Hard, and I'm about to get hot right now. A hard pause. If anybody, and this is all for 112 of y'all, if there's anybody that comes into your DMs and tells you that they can get you a nursing license without taking the NCLEX, that is a fucking scam, and don't you do it. Because number one, you will get caught. Number two, they will take your fucking money. And number three, you will not have a license. Look at that. Look at that. Trying to fucking cheat your way through the system. You get no license. You lose out on money. You get caught. Now what? Now you're going to walk around hashtag fake nursing out here and end up in somebody's papers and then go to fucking jail. Don't do it. Lightning bug. And this isn't my aggression towards you. This is me telling y'all, don't try to come out here and be a part of something by cheating your way through it. Don't do it, because I'm telling you, the community and the nursing community, we don't take likely to that. How does that look? For the fact, you just paid to get a license? Damn. You think I'm going to let that shit slide after all the shit I went through? I don't think so. AKA above the knee amputation. Yep. Do you plan to teach at universities or for a nursing program? Kate, I've applied at schools and at nursing programs and nobody's ever called me back. So that answer is no. That answer is a resounding no. I will not be doing that. But hey, shout out to everybody who's just now joining. I'm going to hang out for about another 15 minutes, or unless you guys don't got any more questions for me. But there's something I do want to show you guys if I can find it. I got a new phone, so I'm trying to figure my life out right now. But what questions do you guys have? Hey, we're talking about nursing. We did NCLEX questions. If you guys are new here, I want you guys to smash that like button. Make sure you guys share. Make sure you guys follow. Also, hey, we're on the road to 100,000 followers. I'm going to need for y'all to make that happen for me. And by the way, we don't know what's going on with TikTok, right? So I need for you guys to go over there and follow me on those other places. Go follow me on those other platforms. All right, I'm trying to find something for y'all. I wish I knew where it was, but I don't. So I got to find it. Hopefully everybody had a really good Easter. My son turned 2 last Friday, so I had a very, 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 very busy weekend with that guy. 2-year-olds are wild out here. Don't have kids. I'm just playing. Make sure y'all have kids. But what other questions do you guys have? I don't know what's going on, so we'll take that off. All right. It says, what's your passing rate on NCLEX? So my program is very, very new. It's not even a year old yet. It'll actually be a year old in July. And the people that are currently in my program right now are people who haven't even opened it up yet because they got it when it was still in its pre-launch. So, but as of right now, there was somebody who just came in here and said that they passed. So the passing rate, I don't know it per se by number. However, people are passing using it. So 60s and above on QBanks are enough to pass the NCLEX. That's not what I said. I said 60s and above show that a good indicator that it's a good indicator that you will be successful on the exam. I did not say that it was good enough, because you could get 60s and 70s and still fail. I was using UWorld, me personally. I was using UWorld, was getting 60s and 70s, and I failed the exam. It says any med search tip for exams. I can't seem to do well on them. So I was about to say Natalia, but for Natalie, I would recommend being in a study group. And I know people are just like, oh no, I don't want to be in a study group. I work better by myself. Well, find people that are like you. Get into a study group. If you're going over 16 chapters for med search, split it up. You do 4, everybody else does 4. You do 25% of the work, you reap 100% of the benefits. If there's one person in your group that's not pulling their weight, fucking get rid of them and get somebody else in there. That way everybody's pulling their weight, and learn off of one another. Learn off of one another. All right. That's my recommendation. That's what I did in med-surg. Listen, I failed my first med-surg exam. And in the moment that I implemented that, 94, 94, 92. And then I think the other one was like a 96. Didn't have a problem after that at all. So he had a pulse. All right, that's cool. It says, did you ever get your TNCC? Yeah, I'm actually a TNCC instructor. And speaking of that, I have to renew it. It expires in like May or June. So it says, thank you. I'll be trying it. Yeah, let me know. Let me know how that goes. It says, do your YouTube have all the questions you cover here? So it goes over a lot of them. So usually after I do my lives, a couple of weeks go by, and then so you'll see this live that'll pop up sometime in the future. So it'll be there. It says, any tips to keep your motivation to studying when things are overwhelming? So if you start to feel overwhelmed while you're studying, get up and take a break. It's okay for you to take a break. It is okay for you to take a break. So it's similar to PHTLS, but for RNs. Yeah, similar. I was a PHTLS instructor too. So essentially, yes. But it's essentially PHTLS, but for RNs for sure. And it's mostly for when I taught it, it's for deploying nurses, and it's for those nurses that require it, such as specifically mostly ER and ICU nurses. But if they were deploying, they were every nurse got it. So if they were OR nurse, if they were a med surg nurse, everybody got it, because you never knew what situation you would end up on when you were deploying. TNCC is the trauma nurse core course. So it's exactly what it is. It's a trauma nursing course to take you through, specific traumas and scenarios and what you would do in order to take care of a patient. It says, agree. I had a study group in nursing school, and it helped me out a lot. I love that, because it helped me out a lot too. First time I will email you. Hopefully I get to it, because I have tons of emails. So if you have a question about anything, you can DM me, but you can email me as well. It says, do your information have fundamentals in it? So I actually do. Inside of my NCLEX community, I went over a fundamental section, and that's actually pre-recorded. I think that was an 1.5 hour long video. So what's your experience like as a male nurse? I had one female nurse try me. And by try me, I mean she tried to be disrespectful to me. I gave her a stern talking to, and we didn't have no issues after that. But I mean, my experience is cool. Everybody tried to, hey, can you help me turn this heavy patient? Me, I'm a nice guy. I like to help people. But then you realize when people start to take advantage of you when you're a guy, and I'm just like, nah, I'm not going to do all this work for you. And that's what happens. And listen to me. People will try to take advantage of you. Listen to me. No is a complete sentence. It's a complete sentence. Money back guarantee on first pass, or you give our money back? No, that's not how that works at all. What I don't give money back, I don't do money back guarantees, is because I have no idea what you're doing. I've literally had people say, hey, I want my money back. And I was just like, you didn't even use the course. So what does that even mean? And so, no, I don't do the money back. I don't do the money back thing, because I don't know exactly what you're doing. It says a lot of times you can't chart in Epic on trauma patients unless you have TNCC. Look, I don't know nothing about Epic. I wish I did, but I don't know nothing about it. I wish I did. It said, I have a hard time saying no to people, the ER. Well, the ER is a little bit different, but when you have people taking advantage of you, that is a very different story. There are so many male nurses now, please. Maybe years ago, that was an issue where you live. What? I don't know. Did you just ask me 3 questions? I don't know. It says, there are many male nurses now, please. I don't know if you're saying please as in like please stop saying that there's not. So I didn't say that there aren't plenty of male nurses. However, the nursing demographic is still 90% women and 10% men. So I don't know. You tell me. Maybe years ago. Look, I look at the demographics all the time, at least twice a year. Nursing, while there may be more men, It's still 90% women. Were you ever a preceptor? I'm about to start clinicals for my EMS class. Yes, I was a preceptor. I was a preceptor when I was a surge tech instructor. I was a clinical coordinator for that. And then when I became a nurse and I started working in the OR, I became a preceptor. So it says, yeah, but in New York, not an issue. New York, not an issue. But it's like that's like saying you've been to every hospital and I know that there's more men there than there are women. I'm just going off of the statistics that's given by the Board of Nursing. That's it. It says in the medical field, not a nurse, a manager, and I don't see that. Okay, and that's cool. Like I said, I just go to where the numbers are, the research is, and that's at the Board of Nursing for the NCSBN, as well as you go to the state. Each state may be different, but on average, nationally, 90% women, 10% men. Maybe I think at the highest, I think it was like 89%. But I mean, hey, tomato, tomato, you know. But shout out to everybody here that's rocking. Hey, if you guys just missed it, we did NCLEX questions almost an hour ago. So make sure you guys like, share, follow. All right. Also, if you guys have any questions about NCLEX and nursing, you guys ask. How many times have you been mistaken for a doctor? All the time. All the time. I even had, when I worked ICU, specifically in the medical ICU, I had a patient, she was dying from like stage 4 cancer, and her husband, I was teaching him about, because she was on a bunch of pressors and we were teaching him like what do they do, and I went to the whiteboard and I started drawing all the vessels and showing him what it did and what to expect, and he was just like, you should go be a doctor. And I was just like, nah, I'm cool. I was like, I enjoy this aspect where I get to do this. I was just like, how many times have you seen the doctor? He was like, twice. And I'm like, how many times have you seen me? He's like, you've been here the whole time. See, case in point. I was like, I don't mind being here. I enjoy this. You know what I mean? So would you immediately quit nursing if you hit $1 billion Powerball? Yes. Why would I be? I would I would quit working bedside. Now, if I got a $1 billion Powerball, believe that's going into a bunch of investments. That's going into what I have to work anymore? Absolutely not. But that money is going to be put somewhere to where it's going to make money for the rest of existence. To use your live, how long do you want a person to utilize it before they take the NCLEX? I usually tell people, not even just my live, anything that they use, give yourself at least 30 days. Especially if you're a repeat test taker, give yourself at least 30 days. At least. Now, if you're a person coming right out of school, you need to take your NCLEX immediate. You need to take it as on the first thing spinning, because all that information that you just got from school is going to start to leave you. Right, the longer that you wait, and I don't want that, and I don't want that for you. Nobody else wants that. Doctor's office, but the nurse's house. There it is. I used to tell my students, I was like, the doctor. This isn't the doctor's area. Like you live here. They just like you live here. They just come to visit. So don't let them come in here and disrespect you and trash your house. And so I graduate in December. I should take it. I should try to take it ASAP then. Yeah, so if you graduate in December, you probably graduate before Christmas. So you most definitely should take it definitely sometime in January. You definitely should. Is it passing high new in what? I don't think I understand what you're saying. You ever had to tell a doctor about themselves? All the time. All the time. Oh, I check them too. Not many of them, but a few of them had to get checked. Even especially on the phone when I'm trying to get orders, and they're just like, I had one. I was just like, hey, so this patient I'm calling about patient so and so. This is this. I think that we need to do X, Y, and Z. And he was like, why are you calling me? I told you, are you serious? Why I'm calling you? He like, it's 3:00 in the morning. I'm like, are you shitting me right now? So is it passing now higher NCLEX rate? So are you saying is the NCLEX percentage higher now? Last year it was like 79%, or for the year 22 it was like 77 or 79%. Last year for 23 it was 88%. So it actually went up like 8 point something percent. I'm just paraphrasing and being kind of vague, but yeah, the NCLEX passing rate went up from 22 to 23. It went up almost 10%. Mostly it's because the years prior, because of COVID, nursing students couldn't go to school. They were doing clinicals at home. They were at a huge disadvantage. Was it hard to check a doctor first few times? Nope, it wasn't. Now, if I was wrong, If I was wrong, that's different. But if I'm trying to ask a question because I legitimately don't know, because you don't know everything, but if I don't know and I want clarification, and if you come at me with an attitude, it's different. If it'd be totally different if I knew that for me as a nurse, I needed to put oxygen on somebody. I'm not calling the doctor for that. But if I've given everything that's prescribed and my patient is doing things that are unexpected, I'm calling you. And if I'm calling you and you're telling me that, hey, best believe we're gonna have a problem. Like I've reported at least, not many, but like at least 2 to 3 doctors. Because doctors forget that they got to go home. I'm just saying. Not all doctors, but you have those select few that they have a God complex. And then you got to, like off of, off of Spartacus, you can show them that a God can bleed. And I don't do all that. I don't recommend doing that. You know what I'm saying? I'm just letting you know that they don't need to be talking to you like they lost their damn mind. It says medication list for patients. What are we talking about? It says, should I not work full time while studying for NCLEX? First of all, I will never tell you what not to do when it comes to financially taking care of yourself. However, the less that you work, the more time you can dedicate to studying. I literally thought I was going to be rich when I become a nurse. Thanks for the bad news. Okay, I didn't say that. I didn't say that you couldn't be rich. I didn't say that you couldn't be rich. One thing I would recommend is that you change your relationship with money. You change your relationship with money. I became a nurse because I truly wanted to help people. But then I realized that there are other ways that you could lucratively make money as a nurse and that you could be extremely happy as a nurse. Me working bedside didn't make me happy. So I'm not there anymore. It says, Lightning Bug, do you know what is a passing percentage score on nurses lab? I do not know. It says, what kind of nursing do you do? So I worked ICU. I worked in a burn ICU, and then I worked in a medical ICU, and I kind of floated to neuro. I did that for almost a year and a half. And then I went to PACU, and I was there for a little bit. Then I went to the OR, and now I work from home. And all I do is create my course, and I coach people. So I essentially have gone the nurse educator route. And I'm currently in school to get my master's right now for nurse education. So it's been a long time coming. I did not want to go back to school, but people were like, you should go back. I had this one lady who been a nurse for 40 years. She would literally come into my life like, Kevin, are you going to school yet? And I'm like, no. And then she'd come into my DMs, Kevin, why aren't you going to school? You know how proud of you I would be? She sounded like my mom, right? So I was like, okay. It says, were you already a nurse when you joined the military? No, I was not. I actually joined the Navy in 2007. I was a hospital corpsman. The entire time, and I was enlisted, and I got my nursing license while I was on active duty. And then I started working essentially like in an internship program, and then I got out of the Navy, and then that's when I started working. I was working in the ICU, and then that's kind of how it went. It says, oh, you have a program? I do have a program. You can check it out. That link is in my bio. It's the 7-day NCLEX course. You go to my main page, click the link tree, and all of my stuff is there. So if anybody wants to join the 3-day live NCLEX review that I'm doing April 12th to the 14th. You guys can check that out. Seats are already filling up. I already see like 8 people that are in there right now. And the seats are filling up. And I'm keeping it very small, knit group because I want it to be very personable. And also I got the 7-day NCLEX course in there, which is an on-demand course. So you guys can check that out as well. Any advice about phlebotomy? I never went through a phlebotomy program or anything like that. So I personally could not really give you anything about that, except for like if we're talking about venipuncture. I mean, you go in at 30 degrees, drop it at 15, make sure it bevels up, same thing. Are you required to have a BSN or an MSN before joining the military? You have to have a BSN before you join the military. If you have an MSN, that MSN has to be equivalent to what the military wants if you're trying to go the military route. So if you're a nurse practitioner, cool. What kind of nurse practitioner are you? The military, they need acute care nurse practitioners. They need, I believe, maybe family practice, psych, for mental health. That's a big, big, big one in the military. So for BSN, they want those, what we call wartime or critical wartime specialties. What exactly is a charge nurse? The charge nurse is the nurse that's in charge of the entire floor. They're in charge of making the assignments. They're in charge of making sure the narcotics are right. Anytime, if anything goes crazy, they're going to be the first ones there to help with a code. They're the one who essentially is responsible for all of the nurses, everything that's going on the floor. But back to your question, Hannah. If you're a bachelor's holding nurse, then the Navy really wants those critical wartime specialties. So like OR, ICU, ER trauma, and med surge. Those are the big ones that they need, because when we go to war, because it's not a matter of if, but when, those are the people that get deployed. It says, I heard hospitals don't accept new RNs. They need experience. Is that true? That doesn't make Mia. Who told you that? That doesn't make any sense at all. How is she going to get your experience? If anything, that's exactly where the new RNs are going to go. New RNs go to hospitals. That's where they want. That's where they want you to go. It says biggest mistake you have seen a nurse make. Many. Probably one of the biggest mistakes that we've all heard in recent years is where a nurse gave a patient vecuronium, which is a paralytic, and killed and gave it to a patient thinking it was Versed, which is a benzodiazepine, which is a sedative, but gave that medication to that patient by mistake and killed that patient. That's one that we've all heard about in recent years. I've seen nurses give medications in the wrong way. I've seen nurses, give a nursing bump of insulin. You're going to see these things. You're going to see them. I've seen, nurses just blatantly just like not do specific things, but all it takes is one bad apple to spoil it for the bunch, right? And so when stuff like that happens, you have to check that. Nursing bump, what is that? We'll say, for example, when a nursing bump, and I'm specifically talking about insulin, when you give insulin, let's just say you're doing it on a sliding scale and it tells you that they need 2 units of insulin. So if I give somebody a corticosteroid, one of the side effects of that is that it's going to increase their glucose, right? So their glucose is going to be high. So if I give somebody insulin, it's going to be based off of the glucose. It's going to be on a sliding scale. They could be like, they can get 2 now, they can get 1 now, they can get 6 later. But what a nursing bump is, which is not a real thing, and don't you ever do it, is they'll be like, oh, the sliding scale says 2. Well, I'm going to give them 4 because it's going to bring their blood glucose from 300 down to a normal level. Don't do it. Don't you ever do it. And that's an example of a nursing bump. Don't ever do it. Let me see what you said. It says, I've been a nurse for 14 years, but I enjoy your live. It's a way to see if I still know it. Hey, I love that. I love that you come here for that, because hey, we all got to do so. That's another reason why I do these, is to make sure for myself that I'm still, making sure that I still got it. It says, can someone become a medic once you join? Yeah, you can. So it depends on what branch of service. The Marine Corps does not have a medical. The Navy is the medical for the Marine Corps. And the medical enlisted aspect of that are the hospital corpsmen. They're not medics. Now, if you try to join the Air Force, they have Air Force medics. And in the Army, they have Air Force medics, which are your whiskeys, your 68 whiskeys, your deltas, whatever. Either it could be combat medics, they could be techs, they could be lab techs, whatever. They have different things that they go through. I'm a psych nurse. Is there NCLEX in that respect, or I'll have to sit NCLEX RN Benjamin? So you must be a psych nurse, like not in the United States, because if you're a psych nurse, you must be somewhere else. And in order for you to work as a psych nurse here in the United States, from wherever country that you're from, every foreign nurse, no matter where you are from, has to take the NCLEX, the NCLEX in the United States. Is it KELDS? Yep, that is crazy. It says, any interview tips? What's a failure that you've had and how do you correct that? Find a simple failure that you did in your life and the way that you rectified it. That's easy. Here's a really big interview tip. After the interview is over, any questions that you have, bring a book, like bring a little notebook, open it up, and then start asking them questions. But one big question I would ask them is ask them about the orientation, ask them about preceptorship, ask them about how long it is, ask them about, hey, what if I don't understand something? Do I get more training? Because I'm telling you right now, even though they may not say it, they will try to pull you off of orientation early for their own selfish reasons. I'm telling you right now, is it true you have to be an officer in order to be a nurse? No, it is true. What is true is that in order to become an officer, you have to be a nurse. Wait a minute. Isn't that what you just said? Is it true that you have to be an officer in order to be a nurse? Nurses are officers. Sorry, let me take that back. If you want to be a part of the nurse corps, you will be an officer. You can be a nurse in the military and not be an officer. I'm proof of that. Now, if you could go the LVN route in the Army, and they actually have designators for that, and you could be an LVN in the Army as well. So NCLEX is required to become a nurse. Yes. Thank you for your service. Thank you for your support, Jenny. I appreciate that. Man, I stayed over my minutes. I'll answer one more question. I'll see what else is going on. So NCLEX is required. Yes, Hannah. NCLEX is required. There's no ifs, ands, or buts about it. And I'm telling you right now, if you try to cheat your way through it, you will get caught. The Board of Nursing, they will catch you. And when they catch you, they will file charges on you and you will go to jail. Oh, would you judge me if I settled for just a CNA? If you tell me that you want to be an RN, and then you're just like, oh, I'm just going to settle for CNA. Yes. And I am going to judge that sentence because you said I'm going to settle. So are you afraid? What are you afraid of? Like, what are you afraid of? And I wouldn't say that I wouldn't judge you, but that's a lie because we all judge each other. Hey, welcome everybody. If you guys are just joining, I did NCLEX questions. Hey, I'm doing a 3-day live NCLEX review that's going to be on April 12th, 13th, and 14th, where we're going to be going over all the NCLEX things that you need to know to pass it, both for RNs and LPNs. All right, so make sure you guys go over there and check that out. That link is inside of my link tree and my bio. I graduated in 2017, never took a boards NCLEX PN. What? Where? Because I don't believe you. And yeah, I'm telling you, whoever that is it Luvia? I don't know where you live, but in the United States, everybody takes an NCLEX. LPNs and RNs. It says, is it possible to be an LPN in the Army as a P? So you can go into the LVN program, Hannah, and they have an LVN program in the Army. Do you have any regrets during your nursing journey? Can I still take it? Luvia, what do you mean? Jason, it says, do you have any regrets during your nursing journey? No, I don't. I don't have any regrets during my nursing journey because I wouldn't even be here talking or teaching to nobody if I didn't have this. Can I still take it? It says, I'm asking, can I take it? Oh, did I misread that? Hold on. It said, I graduated. Oh, I never took the boards. See, I misread that. So is it Luvia? That's my bad. I was just like, hold on. What are we talking about? Because it looked like you said, I never took my boards and I'm an LPN. I'm like, no. But yeah, you can still take it. Luvia, you can still take it. You can definitely still take it. You just have to apply. I don't know what state you're in. You just got to apply at the Board of Nursing. Your application may be expired, so all you need to do is just go to your state's Board of Nursing website, apply to take the exam, pay whatever the application fee is. They send it to Pearson VUE. They send you an email saying, hey, you can schedule your test, and that's how you go and do it. It says, Kevin, what do you do, or what to do after you done failed numerous times? Keep going. I failed 3. Keep going. So here's the thing. If you fail, I usually give people leeway after they failed once. But if you fail more than twice or 2 times or more, it's your fault. It is your fault. So now you need to figure out why. And if you're one of those people that have failed numerous times and you don't know where to go, you don't know where to start, you don't know how to break anything down, that's why I do coaching. That's why I do mentoring. And you guys can find that link in my bio. It is labeled NCLEX Coaching and Mentoring. Come talk to me. My daughter is graduating in April. She has been offered a 5-month nursing residency, no sign-on. Hey, that's good. If she got offered a 5-month residency with no sign-on, that means they can't try to rope her in with money. And if she tries to leave early, which happens with a lot of nurses, she doesn't owe them any money back. What do you recommend new grads start out at? Katie, where do you want to go? I don't like sign-on bonuses is because those sign-on bonuses will keep you. They will. Let's just say you had a sign-on bonus and it's like $100,000, but you have to stay there for 4 years. What if you did it a year? Now you got to turn around and you got to get that money back. But Katie, I would recommend going to wherever you want. Go wherever you want. Shelby says, any study tips for pediatric specialties? I hear it's hard. Pediatric specialties. Well, congenital heart failures, huge for babies, especially if you're working like in a NICU. Man, like I'm not in the pediatric realm, So are you talking about like for class, or are you talking about for like working? California, yeah, Luvia, I would definitely go do that. How long is the NCLEX? You have up to 5 hours to take that exam, and you have a minimum of 85 questions and a max of 150. Did you ever work in VA? I did not. I did not. Or did I at the VA? No, I did not work at the VA. I just passed my NY NCLEX boards RN exam. I don't know where to start. First of all, Mia, shout out to you for passing. All right, congratulations to you. Welcome to the greatest shit show on earth, known as being a nurse. If you don't know where to start, go to MedSurg. Although, listen to me, MedSurg is a specialty, ladies and gentlemen, and that's okay. MedSurg is a specialty, and that is okay. All right. But if you want to get the other fundamentals of aspects of being a nurse, go to MedSurg. If you don't know where to go, there's nothing wrong with that. All right. I graduated in May. What is the best study package you wrote to Archer? Mine, the 7-day NCLEX course, which is linked in the bio. But when it comes to questions, I like Archer. If you were with Nurse Amber, aka or Nurse Glamber, aka Nurse Amber, she's an NCLEX strategist, and she's also one of the homies. She'll tell you UWorld because she likes it. I failed 4 times. I'm planning on doing one-on-one coaching at the end of the month. Hey, I don't know what's stopping you from doing it now. It's $32 for ICU. It all just depends on where you are. But I'm telling you right now, as new grads, they will lowball you. It says, is the VMET document proof of your MOS, or would you go by DD214? It's on your DD214 what your MOS or what your rate is. Me too. I'm saving now to use Kevin. Hey, come over here. Come over here. I'm in nursing school and I start pediatrics rotation in 2 weeks. Okay, that gives me more clarity, Shelby. I was just like, what are we even talking about? What's a really good one? There's a really good one for peds. Peds was actually one of the more difficult ones for me. Peds and maternity, because they leaked them together. I like Khan Academy on YouTube for peds. I think Simple Nursing had a really good one too, so I'm not sure. And Mia, you are welcome. I'm doing Archer right now. Shout out to you, Shanna. I'm in MedSurg clinicals, and I don't know, and I don't want to go there, but that's all I've done so far. Well, you're in because you're in MedSurg clinicals. You're gonna go to peds. You're gonna go to psych. You're gonna go to ICU. You know, like, and then and at the end of school, they usually are just like for your capstone. They're gonna be like, where do you want to go? I want to go to ICU. Okay, cool. Then you're gonna go up there. Usually that's how it goes. I'm not sure, but here's the thing, Katie. And this is for, is it Kelds? I would tell you, is that $32 an hour. That was more than I made as a brand new nurse. I made 25 an hour and in the ICU. And now the ICU nurses over there now, I think, are making like 32, starting out like 32 or 35 an hour. But they lowball new nurses. And usually after 6 months, you get a pay bump. I take my test April 27th. Shout out to you. Dealing with someone telling everyone they are a nurse, but no document to back it up. Oh, it says I credential providers with government and commercial payers. Okay. So one of the biggest ways that you can find out is just go to nursey.com, put their name, their first and their last name, if it's an LPN or RN, and then what state it's from, and then look. And if it's in there, it'll populate, and then you'll see if they have a license number or not. That's that's how you know if we're credentialed or not. Shelby, you're welcome. I'm taking the NCLEX on Friday. Shout out to you, Nelly. I never got an ICU rotation. Thankfully, I had experience as a tech. That's right, Katie, you did say that. In Michigan, we must be lucky for starting wages. Well, yeah, because certain places they don't start you off well. They don't. They do not at all. No license. She says she was an LPN in the Army. So here's the thing. You can be an LPN in the Army and not have a license, which is true. Just like as a surge tech, you can work, because what the military does is you've been credentialed through the military to work only in the military. Like as a surge tech, I was not, or I have students that I had as a surge tech instructor that didn't have their certifications, but they could still practice surgical technology in the military with their experience. And as a nurse, that's different. As a civilian, like you have to have a license. There's no ifs, ands, or buts about it. Now, if it's on their DD214 or whatever their forms are that show that they were LPN in the Army, then yeah, they were LPN in the Army. That just means that they didn't pass the licensure. It says no license, says that she was an LPN in the Army, medic, and OR tech. I mean, you can very much be all of those. I mean, I was a corpsman, I was an OR tech, I became a Navy a master instructor. Like you can do all the people don't realize a lot of the hats that you can do and a lot of opportunities that you have while serving. So I don't put that past her because I mean I don't know her like that. You know what I'm saying? So hey, if you guys are new here, welcome. We did NCLEX questions. We did them off nurseslabs.com. They are free sets of questions. You guys can go over there and you guys can check those out for yourself. But of course, before I leave, last little spiel. Hey, I am doing a live 3-day NCLEX review. A live 3-day NCLEX review. All right. It's going to be April 12th, 13th, and 14th. And you guys can check that out at thebootnurse.com/3-day review. All right. Hey, we're going to be going over 3 days worth of awesomeness too. We're going to break down all 8 sections of the NCLEX test plan. We're going to go over how to break questions down. We're going to break questions down. We're going to talk about new generation NCLEX style questions. We're going to talk about how they grade your test. We're going to also talk about what words to look out for when you guys are taking your exam. I'm going to be going through it very, very thoroughly. How long are the days? All day. Day 1, it's 12 to 5. Day 2, it's 9 to 5. Day 3, it's 9 to 5. Hey, and if you miss it, cool. If you miss it, you get the recorded sessions and you will have access to that. All right. So some people won't be able to make it because they work on the weekend, and that's cool. But you will have access to the recorded sessions. All right. Bull says, after you failed 3 times on your passing attempt, how long did you wait to take test 4? I took my exam. It was September of 2019. And then I didn't take my next exam until June of 2020. Mostly it's because I was just like, you know what? I need to take a break. And then that's when I had found my mentor. I essentially had found me. And then I started studying in January, little by little. And then I started studying really heavy in March. And then COVID broke out. And then when COVID broke out, they kept everybody at home. So I used that opportunity. And I studied every day for 54 days. Originally was supposed to take it in May, but they started closing down all of the testing centers, and I ended up taking it in June. So tutorial, referrals, anatomy, no idea what you're talking about. What are we talking about? But anyways, ladies and gentlemen, hey, check that 3-day NCLEX review out. All right. Like you get the recorded sessions, you get 90 days access to the 7-day NCLEX course, as well as to the community. You get my ebook, which is over 700 pages, which includes EKG interpretation, management of care, delegation, NCLEX questions, as well as pharmacology, growth and development, and so on and so on. And then I'm also working on something else that's going to be given to those people that are a part of the live as well. So make sure you guys go over there and check that out. What's the minimum amount of time we should study for the NCLEX in your opinion? Everybody is different, but on average, my opinion, you should study for at least 30 days. Have you never missed a vein drawing blood? No. Honestly, I enjoyed venipuncture, and I enjoyed venipuncture. So I've never missed a vein. Now, IVs I've missed, but venipuncture, like drawing blood, not so much. So, but of course, ladies and gentlemen, you can join the 7-day NCLEX course for $7. So let's just say you don't want to be a part of the live. The 7-day NCLEX course has 2 on-demand NCLEX reviews in there. One breaking down the 8 sections of the NCLEX plan, as well as a 100-question NCLEX review for the new generation NCLEX. You guys can check that out. And also there's content videos. I just uploaded 10 content videos under the cardiology section to include AFib, AFlutter, VTAC, VFib. I have an EKG, ECG interpretation. So how to read an EKG. Also, we talk about PVCs, normal sinus rhythm, all kinds of stuff that's in there. You guys can go over there and check that out. And if you're one of those people who needs one-on-one help with me, where I break questions down, we go over content, we put you on a schedule, right? We talk about your time management. You get my phone number where we talk about everything that you have going on. Hey, and if you want me to get you ready in 30 days, check me out at thebootnurse.com/coaching. All right. And that is, that's my unshameless plug, because I'm not ashamed of that at all, because it's been so long that I finished school. Do you have any tips on where I should study? I have no idea, because I don't know exactly what you had difficulty on, but I would definitely say start with the big 3, at least the big 2, management of care or coordinated care for LPN, and pharmacology. That's where I would tell you to start, because those are the hardest sections, or the top 2 sections for the NCLEX client needs. All right. So Hey, with that being said, I appreciate everybody being here. We're going to rock it. We're going to be here on Friday. Make sure you guys check out my link tree and all the stuff that I got going on. And then lastly, if you're taking NCLEX between now and then, on Friday, come back and let me know. That way we can, give you all your love and all your flowers and all that good jazz. I appreciate all the likes, the loves, and the follows. But of course, mentally and physically, take care of yourself, because if you can't take care of yourself, you can't take care of nobody else. Not you, not that husband, not that wife, not them damn kids, right? Because it was just Easter, so I'm not going to say what I was going to say about these kids out here. You know what I'm saying? FTK. FTK. All right. Nelly says, I need your help. Nelly, if you need my help, go to my screen or go to my main page, go to my link tree, go to the NCLEX coaching and mentoring, fill out a questionnaire, schedule a call with me, come talk to me, come see what's up. So with that being said, ladies and gentlemen, I hope everybody has a good rest of their night, evening, and as well as on Thursday. And I will see everybody on Friday.